So first, I'd like to say a great welcome to you all for joining us here in Berlin for the joint TEF-Health and eBRAINS-Health Summit, Transforming Healthcare with Trusted AI, Robotics, and Data. And I would also like to extend a very warm welcome to everyone that is joining us virtually via the live stream. And we are really delighted to have you all to share in today's discussions with audiences across Europe and beyond. And my name is Omolola Adanlawo, and it is my pleasure to chair this morning session. And I would like to say that today's summit actually brings together policymakers, researchers, innovators, healthcare stakeholders, testing and validation providers, and ecosystems from across Europe to discuss one of the most important questions facing healthcare innovation today. And the question is, how do we ensure AI, robotics, and data-driven solutions are not only innovative, but they are also critically trusted, validated, compliant, and ultimately, more importantly, they're deployable in real-world healthcare setting. So innovation alone is not enough, but actually successful adoption does require access to testing environments, validation infrastructures, regulatory guidance, high-quality health data, and strong collaboration. So throughout the morning, we'll be hearing perspective from leaders across healthcare research, policy, and innovation who are helping to shape the future of trustworthy AI in Europe. So thank you all for being here. And to open today's summit, I would like to invite Professor Dr. Martin Kreis, the Chief Medical Officer of Charité University Medicine Berlin, to the stage.
Thank you. Well, dear Mrs. Renner, from the European Commission's AI Office, the State Secretary Fischer, the representatives of the EU member states, the guests from government ministries, academia and industries, ladies and gentlemen. I'm really delighted to welcome you here today to our international summit, Transforming Healthcare with Trusted AI, Robotics and Data, Connecting Europe for Tomorrow's Healthcare. This is a very special place. As you may have known, we are in the city center of Berlin, and one of the most ideal locations to have such a meeting with the view on the Paris place. And I hope that you will enjoy a little bit from Berlin, being so nicely situated in this area. My name is Martin Kreis. I'm now for about 5.5 years Chief Medical Officer at Charité, and before that I was director of one of the surgical hospitals at Charité. And why did I do this move away from clinical patient care more towards administration in an executive committee? It's because I'm passionate about improving healthcare for the well-being of our patients, not only at Charité, but also elsewhere in the future. And with robotics, data, and particularly AI, I believe we have new, extremely powerful tools to achieve that goal, which was basically unimaginable in that way only a decade ago or a little bit more. However, when we consider in particular AI, there are always several aspects that usually come to people's mind. One is, can I trust AI? What is the result that is coming out of there? Are there errors in there? Is there a bias? How is the quality of what's produced there by artificial intelligence? Another aspect is, are we in Europe too late? Are we at a position in the competition with other countries like the United States or China? Are we in a situation that we are only kind of lagging behind, that we are only in a Me Too situation, that we are trying to compete with people who are way beyond us? Are we only producing data colonies that are exploited by others, by their systems? And then the question, what is this all going to? What are we up to? What's happening within the next years? Is AI just a tool? Will it replace our workforce? It definitely will influence all our lives, but shall we embrace its potential or shall we be afraid of its detrimental effects? And the frank answer to all these three aspects is we don't really know at the moment. We don't really know what's going to happen in the future. And in fact, this is not so new that we are concerned about the future and that we don't really know what will be happening. What's the best thing to do when we are in such a situation? The best thing to do, I believe, is trying to shape the future, to design it and to develop it. this is the best way to deal with the situation. And in Europe, very often, as I said, we are competing with others in the world, but we should also consider that we have about 450 million people here in the EU among the 27 member states, 450 million people. That's 125 more than we have in the United States. And I am convinced that if we work together, if we manage to combine our strengths and our assets more efficiently in the future, that will be excelling, and that will be at the same level as other countries that are competing with us at the moment. This meeting this meeting is part of this endeavor on a European level, and it should contribute to that. It is designed to stimulate the collaboration in Europe with new technologies for healthcare. Connecting Europe for tomorrow's healthcare describes in a nutshell what this day today is all about. Innovations in healthcare, as you all know, can only realize their full potential if you bring together the different expertises, infrastructure, and the experience across national borders. And this is what we should really strive for, working together. The European landscape has so many assets with its different countries, and this also implies a tremendous potential, because in each national situation, each national ecosystem, you can try out certain things that may not be possible in a different country. But when we see that things are successful in one country, we need to ensure that we can scale this up throughout the whole European Communion. And this is important, that we harmonize regulations for this purpose, that we reduce barriers in order to achieve that goal, to scale things up that have been successful in a smaller size, for example, on a national level. Charité has for many years been part of numerous European research and innovation initiatives. And actually, when you're a member of an executive committee, you're quite proud of that this was possible and happening. But I'm particularly impressed by the magnitude and number of collaborators that are here today, and by the magnitude of these projects, testing and experimentation facilities, the TEF-Health, and the eBRAIN-Health project that Charité, with Professor Ritter and her team, is serving to coordinate, and also coordinating this meeting here. These projects demonstrate what Europe can achieve when we work together, what leverage we have, what resources we can give into these projects and into these topics. Working together and doing all this is not a simply nice-to-have issue. The success of digital innovation is really indispensable in order to ensure a sustainable healthcare system. I would like to remind you that our population is aging very quickly. So we have a lot of old people that we need to take care of, and fewer people who are young who are able to deliver that service. So it's really of paramount importance that we have these digital solutions, that we have AI and robotics in the future to solve that task of having a reduced workforce and an increased demand in the healthcare sector of people who need care. The real challenge in digital innovations, however, is to make sure that they are safe and really beneficial for patients. And this requires appropriate structures and for standardized testing, validation, regulatory input, and so on. These structures, however, must not discourage the development of these technologies. And this is precisely where the European initiatives, TEF-Health and eBRAINS-Health, demonstrate their strengths, which is in ordinary words to ensure that these new technologies are brought to patients in a safe and trustworthy way, so that they can unfold their beneficial potential without inflicting harm on our societies. This meeting, I'm happy to welcome you here in Berlin, has the aim to deliver a substantial contribution to develop this aim, and hopefully we all will be able together to develop from the project level to a continuous and permanent structure to ensure that this development will be well regulated and controlled to the benefit of our societies. I would like finally to express my special thanks to Professor Petra Ritter and her team, as well to all European partners who came to Berlin in order to drive this initiative forward with great dedication. I wish you all an engaging and successful event, as well as fruitful discussions on the future of digital health, with the ultimate goal to improve the health of patients in Europe and worldwide. Thank you for listening.
Thank you very much, Professor Kreis. And up next, I'd like to invite on stage Professor Dr. Ritter, who is the eBRAINS-Health and TEF-Health coordinator.
Thank you so much. Thank you, Martin Kreis, for this wonderful welcome speech. Welcome also on behalf of the TEF-Health and the eBRAIN-Health consortia. It's a pleasure to have everyone here today. And let me move a little bit more to the slides, because I want to show you something. So this is our agenda. You all have it probably on your chair, or you have received it today at the registration. And as you can see, we have really a wonderful set of speakers today. We will hear the perspective of innovators, SMEs, startups, companies, also of major healthcare players. But we also have the member states here today, representatives of many member states that work together in the European consortia that we have heard about. We have a relatively long lunch break, and during this lunch break, you will have the opportunity to visit several booths outside in the sculpture garden. It's, by the way, a wonderful location here. I hope that you enjoy being here in this wonderful place. And the booths will show you services that are provided by the consortia to the Akademie, to researchers, but also to companies. And I hope that you enjoy and take the opportunity to network and speak with the service providers at the booths. So as has been mentioned, the conference has been organized by two European projects, eBRAIN-Health and TEF-Health. eBRAIN-Health is just ending this month, so this is our final event here. And it's a very special project with about 20 European partners who have developed together secure processing environments for European researchers to be able to work on very sensitive health data and to build digital human twins. TEF-Health is not a typical research consortium. It's funded under the Digital Europe program, and it's a project where private partners and researchers from academia are working together to build a European infrastructure that provides real-world environments to serve companies and innovators to validate and test their applications, their products, to be ready for certification and to bring the products faster to the market. So TEF's, testing and experimentation facilities, are defined in the AI-Act. The AI-Act came in force in 2024, and there you will find the definition. Therefore, the European Commission has in 2023 established 4 sectorial TEFs. We are here having the TEF-Health, testing experimentation facility for health, AI, and robotics, and we are tightly collaborating with the other 3 sectorial testing experimentation facilities in the field of agriculture, smart cities, and manufacturing. And importantly, you see here the innovation, the AI innovation life cycle, from the need via the data-heavy development of AI models via technical testing, clinical testing of workflows, clinical trials, and then being ready for regulatory certification and bringing the product to the market. Importantly, this is like a cycle, like a linear user journey or product journey, and this is not the reality. And this is what we will discuss today. Regulatory compliance does not start here, but from the very beginning. And this is where TEFs come in the game. TEFs provide support from the very beginning, from the definition of the need via the data acquisition, model development, and so forth. They provide support in preparing for regulatory certification and compliance. You all are aware of the many regulations that recently have come up in Europe. So Europe has a very strong regulator framework, which of course is good because it saves the values of the European society. You have heard about the European AI Act, the MDR, IVDR, GDPR, NIS2, European Health Data Space, and then recently there came modifications that are presently still under discussion, like the digital omnibus, the simplification proposal. Then there's a possibility per decision, where Commission decision, to actually found infrastructures in Europe that comprise several member states that work together to fulfill the policies of Europe, to build the infrastructures that have the sovereignty that we need in order to exchange the data or provide, for example, testing infrastructure for the AI innovations. So, of course, this is all complex, and therefore the companies who want to bring their products to the market need support. And this is the idea of the TEFs, the testing experimentation facilities that have been founded to support the companies to navigate this complex landscape and to be enabled to actually demonstrate the compliance with all these different requirements by testing their products in real-world environments. And TEF-Health has been funded since 2023 with 60 million euros, half by the Commission, half by the member states. It is funded until 2027, and we are working currently on making the testing experimentation facility sustainable in Europe so it can support companies beyond 2027. As you can see, we have a large consortium of 52 partners. Half of them are private partners, half of them are public partners. Here you see the logos. We have, for example, Karolinska from Sweden on board. We have the LNE, the National Lab in France, that is responsible for developing metrics, standards, but also for certification on board, and so forth and so forth. So what are we now offering? We have currently, as you can discover on our marketplace, on our website, more than 360 services designed for companies, for AI innovators who want to put their products to the test, who want to demonstrate compliance and be ready for MDR, IVDR certification, taking into account the requirements of the new AI Act. So what you can see here are some visualizations of the services that we are providing. This starts with access to data. For example, we had an open call where we invited innovators to access for free the entire national French health data in collaboration with the National Health Data Access Point in France, the Health Data Hub. So innovators had the opportunity and still have to access this rich pool of hospital and registry data in France. And of course, this is done in compliance with GDPR and other applicable regulations. So on top of the data, there will be also secure processing environments that can be used for free to do the processing compliantly. So additionally, TEF is offering support in AI engineering, technical testing, for example, simulated environments. We have a big simulation center here at the Charité, the best Berlin simulation center where products can be tested in simulated patients without doing any harm to the patients. And of course, then the clinical trials, the real-world testing in the hospitals that are part of our network. And the last but not least, the support in regulatory compliance with regulatory competence in our network. So presently, you will be able to discover on our marketplace 366 services provided by 32 service providers from 8 member states. This is our new digital marketplace that is a little bit inspired also by the Amazon marketplace. It has some similar functionality. It is very easy to navigate for companies. Sorry. First, they have to create an account. Then they can select from a richly annotated catalog of services, their services that they want to use. Then they actually can decide if they want to achieve the services for free. Taking state aid, then they have to put in applications, they have to show, of course, the eligibility, or whether they go via the fast track and pay the full price, which is also transparently visible. And if this step has been taken, then a rich team of supporters of TEF-Health front office staff will support the companies to find their best matches amongst the service providers. For example, the best data that really are appropriate and fulfill the requirements for testing their individual product. I want to give you some very concrete success stories, just to make it a little bit more plastic. You find such success stories on our joint website that we have together with other 3 testing experimentation facilities in the field of agriculture, manufacturing, and smart cities. And there you will find a selection of TEF-Health success stories. This one is one of our recent ones that has been provided by Italy, by the Polytechnical University Italy. They have supported a company, AliArm, in testing technically testing an exoskeleton that helps patients with neuromotor diseases to operate, for example, their upper limb. And this technical testing has been performed successfully. Another example from Portugal, the ULS Coimbra, EPE, the public hospital in Coimbra, has supported Healthforce to test the AI pilot, which supports administrative work in the hospital. Yeah, and has been demonstrated that reliably some repetitive manual work in the hospital can be successfully replaced by this application. And then I like this success story very much because this shows that 40% of our services are actually provided cross-border. So the service provider is in another country, member state of the EU, than the company. And this is such an example where, again, Portugal, IPN, Instituto Pedro Nunes, supported a company, XO Research, to test and to document their application Cardio AI, which is for annotation and interpretation of electrocardiograms. And they have provided support in establishing the quality management system that is necessary for CE certification and also for preparing the entire technical documentation. Just a few statistics that you get an impression where we are right now. We have now in the platform about almost 400 registered users. 260 of these are on the demand side, companies who are seeking services, 55 on the supply side, service providers who provide services. And you see the high number of TEF staff. This is our front office supporting the matchmaking, which we noticed is very important because it is not so easy to find in the hospital the right people that actually can support with the right data or with the right testing and clinical trials. And these people in our consortium do this matchmaking support work. So what have we achieved so far? We have by now supported, or we have provided 155 services to about 100 unique companies. And I should also mention that we have 130 applications right now in the pipeline that we expect to serve in the near future. And we are monitoring the TRL, the technology readiness level, to see really what impact are we creating, how are we really supporting the maturity of the products. And here you see our statistics from the platform that is in real time, by the way, generated by the platform that has been developed by the project. It's an open source platform for digital sovereignty hosted in the critical infrastructure of the Charité, so it's secure and in compliance with all applicable legislations. And we see here in blue the entry TRL, technology readiness level, which is around 6 for the products that are starting a service in our TEF-Health infrastructure, and then at the end of the service provision, we see an increase of about 1 TRL point from 6 to 7, which shows that we can help to make the product more mature and closer to the market. And we are also very keen to get the feedback from the companies to learn, to improve, but we are also very happy to see in our surveys that the satisfaction of receiving the services is very high. We have a scale of 1 to 5. We have several domains that we are questioning to our customers, and we see the highest actually satisfaction is 5, the lowest is 1, and most, on average, most users or customers have a rating between 4 and 5, so very high level of satisfaction. And this is just to illustrate that we are ramping up. Yeah, we started slow. We started in 2023. We had to establish the entire infrastructure. We had to establish the workflows. We had to establish prices for the services that are coming also from public entities like hospitals. And this all took some time, but now we are scaling up. We have the pipelines and the tools ready and are very keen to actually meet also here today the companies who can benefit from our service provisions. So coming to an end, the TEF-Health, the testing experimentation facilities in Europe, are supporting from the very beginning the very complex AI lifecycle of bringing a product from the need definition through the development, testing to the market. And we have a hospital network that provides a real-world infrastructure that also could be a very important ingredient to the upcoming AI regulatory sandboxes that are also defined in the AI Act. Might be moved from medical devices now to the medical device regulations. This is right now under discussion, but they will come, and they are already in preparation. We will hear a lot from the ministries today about the AI regulatory sandboxes that also are required to provide companies the possibility, the opportunity to test, to validate their products in real-world environments. And of course, in the clinical, in the healthcare sector, this needs to be hospitals. And therefore, we are very happy that we have already established such a network of hospitals that provide such possibilities. So, in summary, the TEFs are, and especially TEF-Health, the TEF in the healthcare sector, is there to accelerate the market entry of AI and robotics health innovations. This is to improve the health system, to support digital sovereignty in Europe, the competitiveness, of course, in Europe and Europe's healthcare system, and this is to contribute to long-term systemic transformation of the healthcare system in Europe for the benefit of the European society. The very last slide, I want to actually point out that not only collaboration between member states is very important, but also collaboration between the many different players, also the different government groups and stakeholders, in order to make sure that the innovators, the companies, really manage to bring their products to the market. And in another European project where Charité is involved, it's called SHAPED, this is the name, we have recently launched a survey where we want to ask these different players, the health data access bodies that are highly relevant to provide the access to the data on the national level that are needed to develop AI technologies with sufficient quality. There are defined quality criteria in Article 10 of the AI Act, and therefore it is very important that the health data access bodies are aware of the quality requirements that then matter also for MDR certification. The competent authorities, the notified bodies, the MD-AI providers, the companies, the health technology assessment bodies, and the policymakers, of course, not only at the European scale, but also at the national scale. They all are asked here, what is the level of preparation? What is the preparedness given the challenges that we have, and where are the gaps, and what can we do in order to fill the gaps so that the innovation really reaches the patient in Europe? And this is a survey. You can, at the booths, actually takes a survey. You can also go to the website. We would be grateful if you participate, because you are the experts. You have the knowledge, and we are very grateful for your feedback. And now it remains to me to thank you again that you are here, to wish you a wonderful event. I hope that you get a lot of inspiration, and that you enjoy being here together with us in Berlin. Thank you so much.
Thank you very much, Petra. And moving on to the next opening remark would be from Philipp Vernier, from the co-CEO of eBRAINS.
So thank you very much, Petra, and Professor Kreis, for the very important and interesting introductory notes. Thank you, Petra, for inviting me here and for the wonderful organization. It's really nice to be in such wonderful venue, and also the place full of history and symbolic value, I would say. So what about eBRAINS? eBRAINS is the digital research infrastructures for brain research. So it has been the major outcome of the very large human brain project that many of you have heard about. And in fact, it was decided to keep, all the data tools which were developed in the Human Brain Project to transform this into research infrastructures, digital research infrastructures. So the purpose is to be the catalyzer for neuroscience, brain research, and brain health research. This is very important for the future. We have heard the words of Professor Kreis about the burden that brain disease is worldwide. And also, the philosophy of eBRAINS is to really rely on collective expertise to be put together to support multidisciplinary research and expert. And eBRAINS is wishing to become the cornerstone platform for a European brain data space connected to the European health data space, which is intended to transform the landscape of scientific research. We need to change both pace and our habits. I think the digital aspect of science is more and more important. We need to be able to store the data, to share the data, to reuse the data in the most efficient possible way, and it's what eBRAINS is all about. Of course, in particular, in the world where AI is becoming, one of the key aspects of developing science. For AI, you need data, you need organized data, and I think eBRAINS is one of the solutions for this. So a few strategic items that I would like to underline in the framework of eBRAINS. So of course, we need to rely first on scientific excellence. If what we are developing is not excellent, it's not valuable. So for this, you need to rely on the researchers which have the best possible expertise to put them together and developing tools together for addressing what was developed in the Human Brain Project. This requires also more and more openness, which is a challenge in a world where we need also to be protected, so we need both. And we need, of course, inclusivity and community engagement. Again, such an endeavor cannot be done alone. It needs the most possible engagement of all the participants. And at the end, eBRAINS is able to provide a unique value propositions. It's also, of course, of relevance for the pan-European construction, for the collaboration with other infrastructures. eBRAINS is not the only one. I will speak more about TEF-Health in a minute, but of course, we have also other research infrastructures, which is also collaborating to develop solutions for brain health and brain sciences, and we need to work together. And also, for all this, we need to be connected to the power of the computing which is existing in Europe, so hyper computing, and now the exascale developments, the AI capabilities, the AI factories, all this needs to be well connected to the infrastructures. And of course, this will not have any value without any socio-economic impact. And TEF-Health, of course, is an example, and that's why also a way of collaborating. But we need also to have specific pathway to industry and collaboration to help, making these discoveries innovation in the future. And for this also, we are working, as it was said before, to become an EDIC with a specific business plan, because the sustainability of what we are developing depends on this. So eBRAINS is basically collaborative digital infrastructures relying on its national nodes. So we have currently 11 national nodes. You have the list here. And for each node, there is a full member, a leading member. So you see we have a little bit more national nodes than full member, because you can even become a node, without full member if the community is dedicated to support eBRAINS with associate members, and that they will then fight to have a full membership in the coming. So in that case, they are not in the making. So you see that now we have 12 European countries involved in eBRAINS. The tools which are developed in eBRAINS can be organized in 6 different categories. The first one is the brain atlases, the Human Brain Atlas, which is, of course, one of the key outcomes of the Human Brain Project, but we have also atlases for non-human primates, for rodents, for example, that can be connected to the data. The data and knowledge services are absolutely key. In my opinion, it's the most important aspect of eBRAINS. It's what makes it really digital, it's the possibility to gather data together. It's not any kind of data. It's data which are standardized, harmonized, with the right set of metadata to make them findable, accessible, of course, reusable and interoperable, so fair. We have also medical analytic platforms, which is also growing, because we need to reach out more about the medical community also now to enter into this digital era. Of course, all this is made possible by a very strong collaborative platform, and the data and atlases are connected to analysis tools, which are either modeling tools to model, the function of the brain, including the diseased brain, and also simulate the brain at some aspect to generate new data based on simulation, which can be then tested experimentally or in human. And also this is, of course, connected to a computing infrastructures to be able to have the power to compute the data and the models. So this is based on the logical infrastructure, on the logical constructions with base infrastructures. I will not enter into the detail. We have heard about also the sensitive data infrastructures, and TEF-Health is one of them. It's one of the major points of collaboration between eBRAINS and TEF-Health. This is absolutely key. We have then a layer of operation services, which is something that nobody knows and nobody sees, but it's extremely important for the functioning of the infrastructures. This is covered by different centers in Europe. Then you have a layer of core services, like the management of data and knowledge, the user support, the community engagement, the atlases, and then you have what is facing the users, all the services that you can see on the website and which you can directly access to work with. eBRAINS, of course, doesn't exist in a void. It is collaborating with many different European and international organizations, like scientific communities, and for example, the Federation of European Neuroscience Societies, the European Open Source Cloud, EOSC, and EuroHPC, for example. Also healthcare communities like European Brain Council or the European Association of Neurology. Of course, policymaker. eBRAINS is part of the S3 roadmap. It's a project infrastructures in this context, but we're also discussing a lot with national organizations, government agencies. And as I said, we are more and more involved in the industry onboarding and industry collaboration. This is fastly growing these days. Then eBRAINS is also working owing to a very large ecosystem of projects which allow to financially support the activities of eBRAINS. So there are, on the left-hand side, projects which are led by eBRAINS, like big projects like eBRAINS 2.0 or the virtual brain twin, in all of which Charite is, of course, a partner. We have also a project called Implementation, which has been put in place to develop all the elements of becoming an EDIC, which is starting. So you see that this project are really made for building the research infrastructures, building the community, and preparing the EDIC. And we are partnering in another set of projects on the right-hand side, like eBRAIN-Health and TEF-Health, of course, but also others which help also building and reinforcing, strengthening the infrastructures. So just to give you a few examples, I will put them all together. It will be easier. So some of these projects allow us to support the community or the sustainability aspect, like implement or the European Partnership Brain-Health. I will come back to this in a minute. So also to help reinforcing core services, compute infrastructures like RenAI, or I don't get into the detail, just maybe to show you that in fact, for all the aspects which are developed in eBRAINS, we have also other projects which help us to develop this, and we have a very strong and very fruitful collaboration with TEF-Health and eBRAIN-Health, because indeed, I think both the projects are benefiting from each other. You have heard what Petra has shown you before, for example, for the possibility to test AI tools. This is something that, of course, is not done in eBRAINS, but some of the data can be provided by eBRAINS. And also what is developed in TEF-Health and eBRAIN-Health is really I think flourishing and also feeding eBRAINS for all the activities it has. Also, more recently, the European community has launched a very large, which is called European Partnership on Brain Health. It's the first time that a project will support brain research for 10 years, 10 following years. This is funded by the European community, but also by the member state. So it's 30% funded by Europe and 70% by the member state, committed to support brain health research. And in this framework, eBRAINS coordinate the actions of the other research infrastructures toward brain health, to for example, link the existing infrastructures with the objective of the partnership, for building research capacity, because I think for now, researchers, physicians, all kinds of users are not aware enough of the possibilities offered by the research infrastructures. We really need to continue working this capacity. For example, we organized last Friday a very large webinar, which was attended by really a lot of people, to explain what the research infrastructures, which are listed here, this is all the life science infrastructures in Europe, which are collaborating to develop tools for brain research. And of course, which is absolutely key, is to promote data sharing, data standardization among the infrastructures to be able to build this European health data space that we are all dreaming of, which is absolutely key for the future. And then this allow eBRAINS to have a kind of a value proposition for the nodes and for the users, with secured and fair compliant infrastructures, as you have heard, and also, of course, directly collaborating with TEF-Health, for example. It's a single point of access for many tools, which is also something which is very important and which is a real asset for the users. Then it provides a reliable, integrated digital neuroscience tools and services, and they are more and more integrated, easier and easier to use. And for this, you need a collaborative environment and support team, because all these tools are new for many users, so you need to be able to onboard the community, to help the community to use them. We are developing now preferred service for the members to have more and more, differences because the regular users and the one which really commit to support the infrastructures, we need to do that. And of course, because all these aspects, as I said, are still on the making, under constructions, which are techniques which are developing, we need to have a lot of training and education effort. And for this, this is something we are developing very fast, which is very successful, by the way, not only for users, but also for industry. And to finish with, I just would like to re-emphasize the fact that we are now in the road to sustainability, and by trying to make an EDIC, which is already supported by a project in which we have defined and try to implement all the elements which are required for the submission and the application. We are very much helped in this process by the national nodes. And of course, we have now in the process of discussing and trying to commit the member states to our eBRAINS, and hoping that the application will be made soon now. And I think I'm done, and thank you very much for listening.
Thank you very much, Philipp, and I'd like to thank all Petra and also Martin Kreis for the opening remark. And I guess we can all come to the conclusion that from this open remark, it has been highlighted a common theme that is currently in Europe, that we have the population, the expertise, and the research excellence. But then the collaborative platforms and dialogues like what we are having today is very critical for us to be able to maximize this competitive advantage. And then we've also heard about the importance of actively shaping the future rather than just waiting for it, and the need to actually reduce barrier and strengthen collaboration across Europe. But then the critical role that infrastructures such as TEF-Health and eBRAINS play in providing this foundation for trusted innovation cannot be overemphasized. Now, but while these, we can say these frameworks and infrastructures and support mechanisms are definitely essential and they are great, but then the true value is ultimately measured by the innovators who use them. Now, the SMEs, the startups. Now, the next question is, what does this journey actually look like for an SME, for startups in practice, for innovators, and what challenges do companies face when moving from innovation to validation, certification, and deployment? Now, to share this perspective, I would like to welcome Dr. Philipp Boerm, from the co-founder and the Chief Medical and Scientific Officer at Medimia Systems GmbH.
Can you show me this one? This is backward, forward.
So this is to move forward.
Yes.
This is backward, and this is the
Okay,
point.
good. Good morning, everybody.
Thank you, Professor Petra Ritter, for the invitation. So I'm going to represent the small business perspective here today, and I was requested to talk about validation and certification of AI medical devices, our experience and what our needs are. So what a small company can do and what it cannot do alone. So first of all, who are we? We are a small German medtech company. We have Medimere systems. We build clinical decision support system, which is already CE marked under MDR Class 2A. TÜV-Süd is our notified body. We are based in Munich, and this Medimere systems was founded out of a 30-year-old medical publishing company that I founded myself. So we reach our physician users through the publishing company partially, and mainly also through partnerships with around almost 30 medical societies, European Urology, ESMO, ESC was a client. We have a lot of North American clients as well, like American Heart Association, American Diabetes Association, and so on. So, but in our concrete product now, in this Medimere app, we have around 350 CDS tools now. These are translations of medical guidelines in which physician users click their way through a treatment process and come to a guideline-conform treatment suggestion, a recommendation. This is based on these clinical guidelines. And we are now, these tools are, right now, we still build them manually, handmade. This is an artisan job. This is like very time consuming, actually not really scalable. So we are now setting up an AI factory. So a pipeline in which we can throw in a guideline at one spot and then get the CDS tool out at the other end. This sounds very easy, but it's not that easy, of course. So with that, we will be able to generate a large number of those tools like in much less time. So right now we have a deterministic clinical decision support system, which is certified, which is very mature. We have this AI factory in the being built right now, not mature. And the next thing, I will also talk about that a bit later, is a graph neural network where we talk about probabilities and not only about these deterministic rules. So the thing I want to share today is again, our experience, our history. We received our first certificate in 2019. We had 3 TÜV-Süd auditors at our venue in India. We had really prepared until the very last hour, like it was 6 o'clock in the morning, and they were supposed to show up at 8. We passed that exam. It is an exam, but barely. And we were still testing manually. So we had like 3 devices. It was many more devices, 3 operating systems, click by click. So it was a very, very inefficient and very time-consuming process. And the lead auditor was at that time kind enough to tell us, "Hey, Philipp, the way you test your software, that has no future. This is not scalable. This is not, you cannot keep up with that, not under MDR and not under the rules that were at that time still to be coming." So we had built a nice software, but it was not built to be tested. You know, unit tests, everybody knows about that. You have to do them with software, so you also have to build the software. Software needs to be set up that you can do the testing in an automated way. So what followed was a complete rebuild. We threw everything away and started programming from scratch again in Flutter framework, clean architecture, everything testable. And out of that rebuild came a set of rules, internal rules, and I want to share 4 of them with you. This is how we do it today. Rule number one for us is write the master document first, then keep writing. So documents are the truth, not memory, not conversation, not pressure from the management. So you have to write things down first. That will be your basis. Build, so it can be tested, or you will build twice. That's what we did. We built twice. The first time is the lesson. So this is what our India TÜV experience taught us. Rule number 3 is there are no shortcuts. If you, I mean, I'm the boss myself, so there's always a temptation of getting something out now with LLMs to have a wonderful mock-up. It looks awesome, but everything underneath is like is not reusable. So don't take shortcuts. And of course, rule number 4: human in the loop. This is European Union AI Act at its core. So you need to have AI works fast and nice, but humans need to approve it, and that's rule number 4. Of course, these 4 rules. This is one sequence. It's actually one big rule. So we think there is no market without trust. You cannot sell anything if there is no trust in your product. There is no trust without validation. So you need to really validate thoroughly. Without that, you won't earn the trust, and there is no validation without the requirements. Requirements, specification need to be written down. There are no requirements without a master document, and there are no shortcuts. This is a bit about us. Right now we have 3 journeys. We have already out there, certified is our clinical decision support system. This is old school classic software, fixed rules, no AI, but medicine is a bit like that. We have clinical guidelines. These are guideline recommendations. These are rules. So we're talking about a rule-based system here, and that's what we put into our software. So that is already there, and we managed to do that with some kind of maturity, I'd say. Now, our next step will be this AI factory. So these different pipelines for the different deliverables that we have, CDS tools, scores, calculators, and so on. So we will are now working on setting that up. Here, the AI helps us to build the tools. It does not work at the patient bedside, so we can say we work with AI now. We have the foot in the door with AI. This is a little bit our certification strategy. So we have something a bit AI in the system, but it's not reaching the patient yet, and we want to get that certified with TÜV Süd. And then the next step afterwards will be that we have AI inside the product, and this is these. We will set up a hybrid system, neurosymbolic. It's called. It's a deterministic thing that we already have, and the probabilistic thing where we talk about the probabilities, what can happen to a patient, a chest pain patient who enters the chest pain unit. What are the probabilities that it is a myocardial infarction, a pulmonary embolism, aortic rupture, and so on, depending on the current state, and then talk about the probabilities. And but here we have, and here right now we have the strong need for support here, because step number 1 and 2 were still things that we could do ourselves without help, without external help. But this next thing here is absolutely impossible. So we will work with synthetic data that we generate ourselves first, but that's not sustainable. And we need artificial data alone cannot prove a model is safe for real patients. So we need real patient data and in large amounts, and that's where TEF-Health and Petra, Ritter comes into the picture, I hope. So let me just briefly say, what are the needs of, these are our needs as Medimer system, systems, but I think it's general. You can generalize that these are the needs that small business out there have in common. We need funding that lasts to the market, not just like some help at the beginning, but we really need, I think, funding. We need, second point is we need clear and stable rules. Tell us the requirements once. I was talking about our requirements, so tell us the requirements once, and then we can adhere to them. But changing the rules makes it difficult. We need one market, one set of rules. And not different readings of the same MDR in the different member states. So don't ask me how an IFU, instruction for use, has to how it should look like in Estonia. We have it somewhere in our documents, but we need one rule, and not like here national language is demanded. They're not. This is not pleasant. We need enforcement. Yeah. So right now we are tested by the Regierung von Oberpfalz, which is a government body in Bavaria, who is Marktüberwachung. It's like market surveillance. So last year we had our internal audit. We had the TÜV Süd audit. We have an unannounced audit that they just ring the bell and then they are there and they want to see the paperwork. Interesting thing. And this year we had in January an email from Regierung von Oberpfalz, and they also want to see the paperwork, which is okay. And we are not done yet with it, but we will succeed. But I asked her, the lady, hey, why us? Why not the others? Of course, and she said, well, because she found us in one of the databases, DIMDIO or Udamed, and I asked her, yeah, and what about the others who are not in those databases? So I think enforcement is absolutely needed, and not only the ones who sign up in those databases. Yeah, so. And that's the call now. The call for TEF-Health. We need access to real patient data, and by large, so synthetic data is a start, but we need to test our AI properly. So we need safe, legal access to real patient data, and of course, we need these shared testing facilities, like heavily. So we need test centers, sandboxes, and these are things that small companies just cannot build by themselves. So what an SME can do alone is show some discipline. I think we did so. Write your documentation, work on the certification, but things that as SMEs, small business, cannot do alone is the funding. It's data, access to the data, and shared infrastructure. I think we are ready. Let's build what it takes together. Yeah, let's go.
Thank you very much. Yeah, thank you very much, Dr. Boerm. And that was a very insightful reflection. And it's nice to hear directly from an SME to really understand what do you need and what does the SME need from Europe at large, and what do you need to do yourself. And I think for me, one of the key part of your presentation is, I think this is something you mentioned also in the webinar we had about the importance of validation. It's not just something you do at the end, but it's a key part of your journey as an SME and as an innovator in the healthcare space. And I think for me, in that, I'm guessing maybe in your head, you're also thinking that the next question would be, how can Europe create an environment where innovators can actually successfully navigate through that journey? And it's great to see that across Europe, we're seeing different initiatives that are emerging to support companies across this validation journey. Initiatives such as TEFs, the test and experimentation facilities, and of course we have the regulatory sandboxes and the health data access bodies, and they're all there to help facilities to get you access to data and real-world validation opportunities. So moving on to our next session, we would explore how different member states are actually approaching the challenges and what supports and mechanisms are actually in place to help innovators like like Medimer and other innovators out there to actually move from promising idea to trusted and deployable healthcare solution. I think it's nice for us to definitely start with the host country. So we'll be starting from Germany, and we will be having on stage Jonas Marcello, who is the Senior Policy Officer for New Technologies and Data Use at the German Federal Ministry of Health. So over to Jonas Marcello.
Okay. Okay, perfect. Just a brief question. I have 10 minutes, right, only? Okay. Thank you very much. Thank you, Petra, Ritter, for inviting me here, or inviting the Federal Ministry of Health here today to talk a little bit about our approach to AI regulatory sandboxes for health. This is something that we are just about to start. And so I'm going to give you a glimpse inside. Not everything is finalized and ready, but I want to make you guys aware of what is coming, what's coming next, how you can contribute, but also what we are already offering right now with our support and what we are going to fund, especially looking at the previous speaker. So I'm addressing some of the points that you brought up, so this is actually quite nice, but I'm adding a bit more on top. And so let's get started. This is the biggest box here. So this is a slide I actually don't need to show here. In theory, I think you all know this. There was a survey from Bitkom, I think end of last year. They asked doctors and clinicians, do you see AI as a chance or not? And the vast majority said AI is a huge chance for health in the future, which makes total sense. And that's also our approach and our idea. But the very same doctors were asked, do you use AI? And almost none of them, only about 15% something use AI. This number, please take it with a grain of salt or multiple grains of salt. I think some doctors simply don't know which systems already use AI in health, especially when you talk about radiology. And then there is also more and more coming up this idea of shadow AI. So you go to a clinic, you see most doctors nowadays, they use ChatGPT, they use Google Gemini, they use other tools, they use open evidence, or they did use open evidence until recently, or using a VPN now. So there is a lot of tools that doctors are using that are AI, that are not regulated, that are not actual medical devices, that maybe shouldn't be used or should be used carefully. And all this taken together shows us, as Federal Ministry of Health, there is a lot to do, because we want to make this the circle on the right-hand side, we want to make it completely green. And by the way, I apologize for everybody who has green-red difficulties. That was probably the worst colors I chose here. Nevertheless, we really want to make sure that AI is used, and is used responsibly, is used safely, because it can bring additional safety to our health at the moment. What is the problem? Why does AI not come into health as much as we wish? And we identified 3 big hurdles along the way of transferring innovations into use. And I think there are hurdles that we've talked about today already. The biggest one on top here is data. There is too little data access, both for building and for training the AI, but then also for validating it later on for clinical testing. Another huge hurdle, especially for small startups, especially, but also public institutions, for research institutes, is regulation. An SME that already has done a couple of medical devices, for you, it's much easier than if you think back of how it started the first time you did an MDR certification. I think you probably struggled a lot. As most people do. And so we really want to bridge this gap, especially for companies that do their first regulation, their first CE certified devices. And here we're not talking about companies, but also about research institutes. We're talking about health insurances, for example, that now, according to AI.Act, they have to certify their devices as well, even though they're not medical devices. And the third problem, something which is addressed by TEF-Health, especially at the moment, for example, is the access. So a startup or anybody who's developing AI, they need access to patients, they need access to the doctors, the nurses, everybody around them that is using the AI, and they need to see how it is used in real life and in real-world examples. So building on these 3 major hurdles that we see, we want to build regulatory sandboxes, so you're not constantly having to jump across hurdles, but you can leap into a safe sandbox without hurting yourself and hurting the ones around you. And first of all, when we talk about sandboxes and when we talk AI.Act and the upcoming MDR change, everybody has a completely different opinion on what is a regulatory sandbox. Or in Germany, we call them Reallabor, which is even worse term to use. But really, nobody has a shared opinion what they are, and neither do we. So here are the ones that we see at the moment what we want to do. So we do not want to build a laboratory. We have been asked we should make sure there's enough parking spaces for our sandboxes, which doesn't make sense because they're not going to be institutions per se. We're going to talk about frameworks. At the moment, and this is right now, middle 2026, so it will change, but at the moment we don't see the need for dedicated experimentation clauses in the AI Act or in the MDR, because we see that all the regulations give enough freedom and leeway to do a lot of things, and we see that it's a lot of options that are possible are blocked simply by over-interpretation of some of the rules or by being too careful, and there is ways that you can safely really use within the current existing legal frameworks that you can do much more than what is actually happening at the moment. So what we're going to launch is a set of new measures and initiatives over the next 10 years, most likely. So they will change over time dramatically. We want to improve AI transfer into use. We want to make sure it is the gap between development and application is shorter and it's simpler. We want to reduce bureaucracy. A lot of the conformity assessment is pure bureaucracy. All the rules that are there, they're right, they're good, they make sense because they add safety. But the way how it is applied later on, we see a lot of ways of improving this. And in particular, here we want to improve the lives of innovators, because innovators are the ones that bring new innovations that will drive us forward. So we're going to do three major pillars of our regulatory sandboxes. One will be the data access. So we want to start new initiatives on top of EHDS, on top of the German Health Data Lab that exists already. Want to start new additional projects that will help with generating synthetic data, that will help with developing tools that can certify that data will be anonymous. So you can use this, you can use clinical health data, you can run it to a tool through anonymize it, and then later you get a stamp that says this data set is anonymous. You can use it for developing and testing your AI under these conditions. I'm saying here stay tuned because something more will be announced most likely this week about this, probably tomorrow at BioCap. We'll see. So there will be the first glimpse in what we're going to do when it comes to data access for training AI, for verifying it. The second topic is regulatory guidance. I'm going to talk about this 2 minutes more later on in this talk. And then the test beds, which is something like TEF-Health is offering. We want to use a slightly different approach, but we're still in the very early phases of planning what we're going to do there. We want to make sure that there will be co-developing spaces in healthcare institutions. But here, especially thinking about Germany, we're not just talking about large hospitals, but we're also talking about the outpatient care because we see a lot of need of developing, adding new innovations into our outpatient care, and there we have a completely different set of infrastructures. So the regulatory guidance, what are we talking about here? So currently what you have people that are developing software or medical devices. Once they're done at a prototype stage, they go over to the conformity assessment, which takes months, sometimes even years. And then this product gets into use. For AI, that's not feasible anymore because we really need to be faster. So we want to bring this all together, that the regulatory affairs is not happening after the development, but actually conformity assessment is happening during development already and will be part of the regular development life cycle, as it should be, but not always is. And here we're going to start a lot of different initiatives, and as I said, it's going to be planned for the next 10 years. We don't have plans yet for in 5 or 6 years that would be delusional to come up with, but for the first years we have plans, and we're going to start actually next month. We're going to publish an initiative where we will fund pilot projects to develop conformity assessment documentation that will then be published so others can use it. Over time, we want to make this whole life easier, and we want to automate a lot of these things. So when you talk to software developers nowadays, they're all using Copilot, Claude, or whatever to develop their software to help them. They're using AI already to assist them with software development. Why can the AI not assist them also to make sure they're developing it conform? The AI, they can check the ISO norms, they can check the regulations, they can check the risk management system they have in this company, and in real time tell the developer, hey, you're missing some parts of your risk assessment here. Oh, you should add new risks because now I'm seeing the application is doing this and that. And these are tools that you can add that will just be run automatically in the background. There is no extra work for the people. There's less bureaucracy. These things will be done. This is our goal for 2035, maybe a little bit earlier. That's where we want to go to, but we need to take some small steps in the beginning to get there. And this is now where I say, please join us and work with us together. So early July, we will publish a tender, and I'm looking at you because we're also addressing small enterprises here that currently are developing a product, and they need some regulatory assistance with this. And we're going to not give you the regulatory assistance because we as ministry cannot offer this, but we're going to pay you so that you can buy proper regulatory guidance, can develop some blueprints or some clear guidelines for some parts of the conformity assessment, and in return we are going to publish it so that your competitors can use it as well. This might not seem in your best interest, but it is in our, because we want these documents to be open and free so that everybody can use them, especially startups and small innovative companies or researchers can see these documents and can work with them and know what are they needing, what are the needs for the confirmation assessment later on. And with that, I'm left. So prepare yourself. If you want to take part, I can really, really recommend this. In July, we will publish the tender. The projects have to start in September, so we're really trying to speed up here with what we're doing. And with that, thank you very much.
Thank you very much. And now we'll move on to Sweden to hear from Sweden. And I would like to welcome on stage Malin Vestin, the international specialist from the Agency for Digital Government in Sweden. Over to you, Malin.
Thank you very much, Lola. Yes, so from some German perspectives to a Swedish one. My name is Malin Vestin, and I'm here representing the Swedish Agency for Digital Government. And at this agency, I work as the national contact point for the Digital Europe program, which is funding many projects within, for those of you who don't know the Digital Europe program, it's an EU financing program that's focused on deployment. And one of the projects, or two of the projects, are represented here today, and that's TEF-Health and eBRAINS. And I'm going to talk a bit about the Swedish path towards signing a letter of intent for TEF-Health. And I'm going to start off by talking a bit about linking this to recent developments in Sweden. And one such recent development that has helped us is a strengthened national co-financing of the Digital Europe program. And for those of you who are aware of the program, you know that most of the projects that are part of the Digital Europe program, they are financed 50% by the Commission, and the other 50% has to come from other sources of funding. And here, from our perspective, national co-financing is essential because it helps us to support Swedish projects that are part of the Digital Europe program. And it's also written in the increased support in the co-finance to the Digital Europe program that two prioritized areas of the increased national co-funding is secure and efficient AI, including applications in healthcare and health services. And it's a major increase starting from this year with a co-financing strengthened by 100 million SEK annually per year. So it's a huge improvement for us. Another recent development that has helped us move forward is that Sweden last year published a new national digitalization strategy. And this digitalization strategy includes 5 strategic areas, and these are digital competence, digitalization of businesses, digitalization of public administration, connectivity, and digitalization of welfare, of which life sciences and health is a part. So we see that health and life sciences are strategic priorities for Sweden. These are identified in Sweden as key areas for transformation and innovation. And the digitalization strategy at the national level, as well as the increased national funding, highlights this growing focus on health and life sciences. But we also see an increased focus in Sweden, as well as I think in many other European countries, on European collaboration, and it's getting more clear than in a long time that the European collaboration is essential for maintaining competitiveness and for accelerating trustworthy AI adoption. But strategy and financing is not enough. We need mechanisms that help innovation move from development to deployment. And this is, TEF-Health is one such mechanism. Let's see, I think we moved a bit too fast here on the, here. And we also see that Europe has ambitious goals for AI in healthcare. And innovators need access to testing environments, expertise, and health data, as well as regulatory support. We see that TEF-Health is a bridge between AI innovation and health care implementation. And we see that Sweden has a strong contribution to TEF-Health. We see that Sweden has strong expertise in health, in AI, in digitalization, and in life sciences, among others. And Karolinska Institute, as the Swedish coordinator for the Swedish node in TEF-Health, has a key role as it's participating in all of the work packages. And also, it has a key role nationally through supporting innovation and health in AI solutions. So we see that TEF-Health demonstrates a concrete value and creates concrete value at the national level, as well as strengthening European collaboration. I think this is moving forward a bit too fast here, my presentation, but yeah, thank you. So what TEF-Health is doing is delivering strategic value through supporting Swedish SMEs and innovators, providing access to testing environments and expertise, strengthening readiness for EHDS and AI Act, among others. And it also creates synergies with other EU programs or projects such as eBRAINS, GDI, Genomic Data Infrastructure, EU-KIME, and Health Data Sweden, among others. And it enables secure use of sensitive health data. So we see that TEF-Health is delivering concrete results, but a key question now is how to build a sustainable way forward. And we see EDIC as a potential sustainability model for this. Because TEF-Health has built expertise, networks, infrastructure, and practical experience in testing and validating health AI, but the problem is now that the project stops in 1.5 years. And we see that TEF-Health has created capabilities that extend beyond a single project. So preserving these capabilities requires governance, funding, and a clear mandate. And we see that ethics offers such a structure for organizing long-term European collaboration around these shared assets and expertise. And this is why we in Sweden wrote a report in the end of 2024 that outlines how the ethics are supposed to work, and it's delving a bit deeper into how we should handle this at the national level, because I think many of the countries represented here today have shared these questions around ethics, how they are supposed to work, and how to make decisions on whether to join or not. And some of the key messages in this report that we are happy to share to those who are interested is that we see that ethics are becoming a key mechanism for delivering Europe's digital ambitions and future digital infrastructure. And participating offers Sweden opportunities to influence priorities and to access funding, as well as strengthening strategic partnerships. And we see that problems with unclear national decision-making processes risk reducing the Swedish influence and limiting access to future benefits. And we see that Sweden needs clear governance and stronger national coordination. So one of the conclusions of this report was that there are still questions around ethics that needs to be solved, but from our perspective, the cost of inaction and not having making conscious decisions on whether to join or not is maybe greater than the cost of participation. And this is why we, in the recent year, has decided to sign 4 letter of intents for ethics within the health sector. And one of them is TEF-Health ethic. And the others are also in the health sector, so those are EUCAM, Cancer Images Europe, Genome ethic, and eBRAINS-Health. And the eBRAINS-Health is the last one to be signed. And we decided to sign this letter of intents quite early in the process because we see that have a letter of intent provides us an opportunity to have an observer status, which creates a valuable learning opportunity. And we also see that as a letter of intent is not legally binding, it gives us an opportunity to show our commitment and also to engage early, which creates strategic advantages. And as far as I know, Sweden is the first country to sign a letter of intent for TEF-Health. And I think our key message here today is that we are happy to share our thoughts on signing this letter of intent and to share how we were thinking while coming to this conclusion. And we are also happy to share more details on the actual document if needed. So please don't hesitate to reach out to us if you have questions on how we were thinking about this process. In my role as a national contact point for Digital Europe, I often meet national contact points from the other member states, and it's clear that this is ethics is a quite new phenomenon, and there's a lot of uncertainty here. So I think we have a lot to gain from discussing together and learning from each other. So please don't hesitate to reach out to me or my colleague Eva Thylén, who also works with me as a national contact point for Digital Europe program in Sweden. And the QR code goes to our website where you can read also more information, and you can find the report on the ethics. So great thanks for the attention, and great thanks for the organizers for the opportunity to be here today.
Thanks a lot, Malin. And so moving on from Sweden, we'll go to Chechnya, and I would like to invite Zdeněk Gunther. So apologies if I'm pronouncing your name wrong, which I guess I am, but apologies for that.
Good morning, Zdeněk, Gütter from Czech Republic. So thank you for invitation and opportunity to speak about the Czech Republic perspective. Thank you. I have my presentation divided in 5 sections. And obviously, if governmental perspective, we must start with strategies. We already have 2 strategies. One was developed in 2019, but found obsoleted quite early in 2023, though it was planned to expand its objections to 2035. But the AI technology has been developing so fast that it was necessary to develop new one. And this is approved already in July 2024, and it classifies 7 interconnected areas of society life, and including public services. And inside there is also healthcare. And what is important, it already references to AI TEFs and AI regulatory sandboxes. What is interesting, the ambition of this, how it looks like, but also the vision speaks about the Czech Republic is a major center of artificial intelligence, with so on and so on. So let's speak about the concrete actions. We, on the Ministry of Health, developed several action plans. One of them was devoted to AI sandbox. I will speak about it later. And then System Information Center for AI healthcare, and then several other action plans to make available data for AI, and also to support the AI TEF node in health. But the strategy and even the action plans didn't bring funding. That means funding must be assured from other sources, by other measures, not just by the strategy or the action plan as such. So currently the activities of various entities in the Czech Republic are co-financed from European Union or from other programs in the Czech Republic, like Development Agency and so on. And here are listed the selection of the major activities for support of AI in the Czech Republic. Obviously, networks of excellence. There is one on the Czech Technical University in Prague. We have 6 EDICs, but no one is dedicated to health as such. Just 2 of them are marginally dealing with health technologies or applications for healthcare. We have national DICH, which is dedicated to health in all modes, but they didn't classify for EDICH. And what is new, we started to build Czech AI Factory. You know, this is the relatively new activity in European Union to build networks of gigafactories. And it is coordinated in my country by Technical University Ostrava and already existing National Supercomputer Center, IT for Innovations. And it will obviously support training of complex AI models and all these needs, all these AI needs that require high capacity computing. Many entities or many institutions from academia, from industry also use research innovation projects financed by EU, and of course there is AI.TEF. I will speak about this here. We conducted a survey from 2020 among various academia institutions and also hospitals who may be interested in participating in AI.TEF-Health. And the result was only one had courage to participate and join a consortium in 2023, to my knowledge. And it was success. The consortium won. And we are here now. And the partner is Masarykovo University in Brno, Muni. And it's quite active, of course, at that time when we fighted for participation in AI.TEF. There was no funding assured from the government or from the Ministry of Trade and Industry. Because the funding was already dedicated for traditional Czech discipline, which is manufacturing. So we have quite intensive AI.TEF node intensively working AI.TEF node in Prague, in Czech Republic. And it participates in AI.TEF I Matters, which is about robotics, data and digital twins, but all in industry, not actually almost nothing related to healthcare. What is the status of the implementation of AI Act? There was a governmental proposal to implement AI Act, which was discussed in May 25, and the document already contains provisions about the sandbox, but the sandbox is meant the sandbox referenced to in AI Act Article 57, and the document actually was very detailed in nominating the actually institution which will be the sandbox, and also method how to finance it. However, then Omnibus 7 came, and this legislative package possibly changes will change the environment, and therefore the proposed implementation of AI Act, including the sandbox, was postponed. So it was not approved by the Parliament. And of course, EHDS regulation, which is a matter of Ministry of Health I work for, and that's our, let's say, major activity in this period of time after the regulation was approved last March, or March 25. What about the sectoral AI sandbox? That means we speak about the major sandbox, which is referenced in Article 57 of the AI Act, but there may be also other sectoral AI sandboxes. And there is already a legislative infrastructure in the Czech Republic for creating of such sandboxes, which is very detailed, and it's actually guidelines for ministries how to create new sandbox for the purpose of the sector they work for. And this is opportunity for not only healthcare but also for other sectors to create sandbox for the needs they see as a urgent, or they require some kind of activity. And for example, in healthcare, it may be for many purposes, but definitely the continual learning, machine learning models in healthcare is something which is quite sensitive and critical to certificate, and therefore this is one of the items which might be subject of the sandbox. And therefore we already created a concept in 2024 for sandbox that will provide services that the market surveillance authorities and notified bodies cannot provide because of the legislation or their capabilities or other reasons. And that's the idea, and also the second idea that the regulators can even get some kind of inputs for their policies from the activity of the sandbox as such. And this was the original concept of the AI regulatory sandbox for healthcare, which is actually an ecosystem containing the regulator. It is in the green box. That means there are three entities actually involved in the regulation ministry, then the drug control institution or office, and Office for Standardization, which accredits the notified bodies. And the actual knowledge is in the cube, in the blue cube, and there are three coordinates. One is technological, AI technology. The third one, that means the red one, is the technology. But the other one and two, they are medical or healthcare oriented, either application area for the AI, for example, diagnostics or therapeutics, or different modalities like images or sound or whatever, or medical specialty, that means cardiology, radiology, whatever. So the idea was the coordination. The green box will have contacts to the experts, to actual institutions that can provide these various services in the technologies or medical disciplines or application areas, and to be able to satisfy the requirements of the users that will apply for the sandbox in a selection process. However, the market, as also was briefly mentioned by other speakers, is quite specific, and it was not indicated as a major priority to establish such kind of even light sandbox. That means not an institution, but just a coordination and network of experts. But still, the Czech companies, either they are not so numerous, and their products are not that demanding that they can really use the traditional ways of certification, MDR, and in future also AI Act. But to create a dedicated sandbox, it was decided that it's too early for initiating such activity, even though it will be a light operation. Instead, we provide consultancy information services. That means a very soft operation, and also methodologies and deployment guides as a documents. They are issued by the ministry, and also there is activity to monitor the AI use in healthcare. What is the trend? What are the trends, and so on. The ministry created also a new department for innovation, strategic development, and AI this year. So this is what actually happens with the sandbox, and the private sector as such, they recognize the need to do something in the regulatory sandbox topics, and therefore they created a new initiative, which is actually backed by a company, advisors, and they provide methodological implementation support for various entities, but the entities are usually ministries, like Ministry of Social Care and others institutions like Innovation Agency, and also regions in the Czech Republic. And the first proposal they should release in June this year will deal with a methodology for regulatory sandboxes in the social field. So this is in brief the situation in my country. Thank you for attention.
Thank you very much. And now we're going to be moving on to Italy, and we're going to be having Fidelia Cascini who will be joining us online. And yeah, I think we can connect now to Fidelia. Great.
Hello? Okay. Okay, because I can't hear you. And I would like to ask someone to share the slides because I don't see the function on the screen to share my presentation. I don't know if there is someone that... when needed. So first of all, the next one, please. I'm sure that it's not, okay, now I see the screen. Yes, please, the next one, please. First of all, thanks for inviting me to speak about this very interesting and relevant topic for all the European Union and member states. First of all, I suppose that it's not a surprise that we live in a very complex EU context, especially regarding regulations, which are relevant for the domain of AI in the healthcare sector. The next one, please. As you all know, the situation is that we have to consider many different regulations which are relevant in this domain. And even if the European Union is going towards an integration of these regulations to facilitate their applications and the simplification of the requirements, however, we have several regulations for allowing data access, which is fundamental for the development of AI, other regulations which are relevant for building a trustworthy AI ecosystem, and finally other regulations which are fundamental for bringing value and for the sustainability of healthcare systems applicating the AI. Next one, please. So within these regulations and built on this regulation, there is an ecosystem which is populated by several actors, especially if we look at AI in the healthcare sector and the relevant elements which are related to data access and data use. These actors will interact in the ecosystem with different roles, which are clearly defined by the different regulations. The next one, please. So we have in the AI life cycles so many different actors with different roles, with different functions, which are more or less established by different regulations, and the member states has the obligation to consider also in the national legislation these framework for the implementation of these new tools and the application of the healthcare sector. The next one, please. The strategic layers that are relevant from our perspective to facilitate this, the creation of this ecosystem and to facilitate the application of the requirements of the regulation, even at the national level, are mainly based on three aspects. Next one, please. The first one is related to the data governance, which is now clarified by the HDS regulation, especially in the field of secondary use, and the platform, the infrastructure, which is Health Data ATU, which is the network where all these different actors can be connected, also regarding the development and the implementation of the AI. In particular, within this ecosystem with different actors, enabling data access and providing data for the AI training, testing, and use, we can recognize a role of the TEF-Health within the network as an authorized participant. So a fundamental part of the ecosystem where these kind of networks, which are based on common infrastructures and common objectives, can be recognized as part of the ecosystem and can be integrated in this ecosystem to facilitate their role and the provision of specific services within the ecosystem. Next one, please. So the second relevant layer, once we have considered the data access, is that related to the AI life cycle, and especially regarding to these, the interplay of these different regulations, because we have for sure the part which is related to data access, which is mainly under the framework of the HDS and their actors and their functions and their obligations for the member states, but we have also another part of these AI life cycles, which is strictly related to other regulations as medical device, AI Act, and health technology assessment regulation. And within this framework, the TEF-Health is extremely relevant for the validation of AI product, and mainly in the pre-market phase, but not only to this, limited to this phase, because the interest and the activities provided by the TEF-Health can be very relevant also in the post-market phase, and for supporting all the decision makers in the provision of authorization for the use of these new AI tools. The next one, please. The third relevant, so the TEF-Health in particular can be seen as a trusted validation ecosystem, which is useful for developers, regulators, notified bodies, and healthcare providers for all the services that is able to provide to create trust and to facilitate the development of the AI tools and the introduction into the healthcare market. Next one, please. The third layer is relevant as the others, and it is mainly related to the creation of a very clear framework regarding roles and responsibilities, because according to these different regulations, which are all consistent with the domain, and all the national legislation have to create a national legal base which is compliant with all the requirements of the regulations, but at the end we have some problems related to possible duplication of activities looking at the regulations, and different assessment for the same things required by different bodies, and possible conflict of interest which are possible within the same organization, which could be very different roles for the same goal at the end. Next one, please. So what's the Italian approach to face or to deal with this complicated matter? First of all, next one, please. Italy is building a multiple HTABs model to facilitate a sustainable data access ecosystem, which includes the responsibility of different public authorities, all involved in the healthcare sector, and that have the controls of different data flows according to the expertise. So we are building a different, a multiple HTABs model to facilitate the sustainability based on the expertise and proximity to different data flows which are relevant for building also AI tools and to strengthening the AI healthcare ecosystem. Next one, please. To create this model, for sure, we have a competent authority, which is the coordinator of this board, and we have the Ministry of Health leading the group. But in this group, we have interactions with all the authorities which are involved in the development of AI for healthcare also not only the authorities which are involved in data, health data and data access, but we have the different organizations and the different public authorities which are fundamental for the implementation at the national and local level of all the requirements which are necessary for the implementation and the use of AI in the healthcare context. The next one, please. And to provide the best work of these different authorities, we consider that within this framework of the national board, we have different subgroups working on different topics. For instance, the topics regarding governance and legislation, which is entitled to map all the European regulations which are relevant in the same domain, and also the national legislation which are currently available on the same domain, to facilitate the integration and the harmonization for both the European and the national level in the implementation of AI, also for supporting the activities of provider manufacturers, which are currently quite confusing looking at the current legislative framework and the future of the development in the market. Other working groups are focused on specific and technical aspects as interoperability and the different applications in the healthcare sector as primary use, and also the use of data for the secondary use, which are mainly focused on strategies and operational aspects to implement the different regulations after their mapping and integration. The next one, please. So in this context, we have now facing some particular situations, because we have different competent authorities and public institutions which at the same time have to manage different roles and responsibilities and different functions. For instance, we have the concrete situation where one public entity is entitled for providing different roles which are demanded according to the different regulations that we have seen before, and that have many responsibilities. And there is also the risk of conflict of interest within the same organization, even if it is a public authority, according to the regulations and the demanded roles and responsibilities which are asked to the same regulation. So now the challenge for our member state is how to combine these different expectations and tasks which are demanded by the regulations within the same authority, which is relevant for enabling the use of data, of health data, and the use of AI within the healthcare sector. I have no answer regarding this because we are still discussing, and maybe this is not an isolated case if we look at other member states, but it is currently what we are dealing with to allow the integration of different functions, including that provided by TEF-Health. Next one, please. So in conclusion, to deal with this complicated matter, at the end, it is important to consider that there are recommendations to follow as a driver for providing the best solutions at the national level. First of all, we should implement the system and realize an ecosystem where it is possible an independent validation of the new AI tools which will be developed and available on the AI market. Then it is very important to find an harmonization on how to collect and provide evidence which is based on health data for the development and for monitoring these solutions once they are available on the market. And we have to integrate all these different entities working on the same thing. Also, we have to work on transparent audit trails, which are relevant for guarantee that all the implementations and all the tools that we are using and we are going to provide in the healthcare market are trustable. And this is something which competent authorities and public entities have to work to guarantee people rights. Then the separation of the roles in the same organizations, because the risk is that to create situation of conflict of interest where different functions and responsibilities are up on the same organization, and it's different to separate the responsibilities and the services which are provided within the same organization, which organization for sure, which are public organization that has also the role to validate, to certificate, to approve several steps of the AI life cycles. And finally, the governance of the risk, which is for sure related to the practical implementation and the use of these solutions, which is something more related to the monitoring and the verification of the solutions which are already available on the market, but it will be something which is also demanding for an activation of the all AI life cycles, because even if at the end the product which is available on the market, it is already based on a previous data access and a previous validation and certification, but we know that AI is evolving technology. So probably in the future, we have to expect, even during the monitoring phase, during the post-market phase, a continuous need for new data access, new application for data access, and a re-evaluation in the same life cycle for maintain the new technologies up to date and coherent with the legislative frameworks. The next one, please. And it is the end of my presentation. I would thank you very much for your attention.
Thank you very much, Fidelia. And I think that was a very nice session. And I think across these presentations that we've had from the 4 member states, and I think what stands out most is that the importance of supporting AI in healthcare is not just about a single regulation, it's not about a single institution, and neither is it about a single program, but it is all about how we can support the entire AI life cycle. And I mean, we've heard about access to data, regulatory sandboxes, the EHDS, testing and experimentation facilities, certification pathway, health technology assessment, deployment and post-market monitoring. And each of these elements do play a role in helping innovators move from an idea to a trusted solution used in the healthcare sector. And we've also seen, like, while the 4 different member state presentations we have may organize these mechanisms differently, there is a common objective across board, which is creating a clearer pathway for innovators navigating an increasingly complex regulatory and operational landscape, which is also evident from the presentation we had from Philipp Boerm earlier. And we have also seen that the challenge right now is not only about building this individual component, but ensuring that they work together in a coherent ecosystem. And I think it's important that we note that the landscape currently is evolving, and we do not have all the answers yet. But then a continued dialogue like we're having today is still critical for the future of healthcare in Europe. So moving on from that, we would have the opportunity to engage you all with the presenters from the member states in a Q&A. So I would like to call back on stage Zdeněk and Malin, and also Jonas and Fidelia, who will be joining us on stage for Q&A. Yeah, please come back on stage for the Q&A section. So, yeah. That's the wrong slide, so I think we can just ignore the slide for now. Yeah. No, this is the wrong slide, sorry.
The wrong slide.
Yeah, sorry, apologies. Yeah, so we would have the Q&A, so we'll take questions from you all, from the audience. I mean, it's been quite a morning of a lot of information, but specifically on the member state presentation you've heard. If you have any question from Jonas or from Malin or from Zdeněk about what's happening in Chechnya, in Germany or in Sweden, and I don't know if Fidelia is with us online, we will be taking questions. So if you can just kindly raise your hand, and I do hope we have questions. I do think there were a lot of things presented that evoke thoughts and exchange that we can further have. Okay, so first question.
I have a question to Jonas, Marcello. We are engaged in some research projects, and the outcome of all these regulations are that things are not easier than without them. So when we approach a hospital, we need to talk to, that's what I heard, with 11 people. One is in charge of MDR, the other one for GDPR, cybersecurity, and so on. And for startups like us, this is it's a lot of work. And so, do you see that problem? And everybody bakes his own MDR, you know. And so, how do you understand that problem? And what do you do about that? Thanks.
Okay, that works. Yes, thank you for this question. And yes, we definitely see this problem. So we see that there is a lot of over-regulation on a local level, I would call it, and that a lot of the regulations are applied in a more complicated way than they might to be or should be implemented. And we definitely see this in a lot of ways when you talk about data protection, for example, is that the local data protection officers in the healthcare institutions, they, to put it bluntly, they don't have any incentives to say okay to a project, because in the end, they would be liable for any issues that appear, any data-related issues, but they don't get any reward for saying okay. So they always caution more on the side of saying no rather than saying yes and enabling. And so this is one of the aspects, and with MDR we might see similar things, but this is one of the aspects that with our regulatory sandboxes we want to address by putting out blueprints and putting out clear, informative frameworks that were used for other projects. So we can say, look, this particular project, this company used that kind of data, and this is the security mechanisms they used. And we have a data protection agency that okayed this and that gave these demands. And when they are fulfilled, everything is fine. So hopefully that we give guidance also to the data protection officers and to the regulatory officers in the institutions, that they get some assistance and see, okay, this is a blueprint that was okayed by other regulatory bodies. And for us, it is fine if you work along the same way. So this is one of the approaches that we want to go with the regulatory blueprints that we're building.
Thank you very much, Jonas. Okay, Petra.
Thank you. This is very interesting because I noted in your response, Jonas, that there are different stakeholders involved. There's a company who wants to test the device in the hospital, but you mentioned also, for example, the data protection officers who would be the ones in the hospital, of course. So I think there are many contributors to the testing, and what I find tricky is to come up with a good business model, that everyone is reimbursed for their contribution to the testing. Is there anything in the making related to that?
The reimbursement is a different topic. When we talk about data protection officer in a hospital, I don't want them to get money payments for providing data. This is not the approach that we want to take. And the data protection officer in a hospital has the duty to handle these projects. At the same time, we don't want to commoditize health data in a way by making it a business plan to address this. But we definitely want to find ways how we can make sure that hospitals or healthcare institutions have an incentive to help with the development of novel new technologies, so that it's not an extra burden for them, but that it becomes part of their responsibilities and that they're staffed accordingly to handle this.
So maybe to share a little bit the reality in the hospital, the researchers, academic researchers in the hospital now get the feedback from the hospital that they're overwhelmed with data protection impact assessments, and please don't submit more. So now imagine that companies from external coming, this needs resources. They don't have very small, they have very small teams. They don't have the workforce to do all this. And of course, this costs money and needs to be budgeted. And the main business of the hospitals is at the moment still to care for the patient, to have the beds full. They get reimbursed for this. This is part of their business model. And of course, they have to think about finances because this matters for their existence. So ideally, there would be new business models where supporting companies, for example, is part of that. And this needs to be budgeted as well, of course.
And when we talk about data protection or in general, like applying all the regulations, what I said, there is a lot of overcomplication in a lot of different ways. I'm not blaming anybody for this, but there is a lot of things that can be done on a technical level. Like you don't need people to write 40-page documents for a data protection assessment, and then somebody reading these 40 pages and then writing a 5-page summary, giving this to somebody who will then say this is okay or not. There, we created a lot of bureaucracy along the way, and this is something that we want to address. And when we have these blueprints, we will have automated ways how these projects, or this is our goal, to have automated way how this can be assessed and checked so that we don't need human resources for stuff that can be done automatically because there are clear yes and no frameworks along the way. This will not be something that we will be finalizing in 2 years, but this is our aim that we are going for, both in legislation and also with the approaches like regulatory sandboxes.
Maybe just a final remark, because I really think it's important that, of course, such services, providing support to companies is needed, but I think it costs money. That's very clear. And I think it's very important to discuss this and talk about this as well.
Thank you very much. And Fidelia is still with us online, so if you also have questions for Fidelia from Italy, so please. But we have 2 questions already, so okay.
Yeah.
Okay, 3 questions now.
Yeah. Okay.
4.
Yeah, thank you very much. I think I really enjoyed all the presentation, and I see there's a quite common themes there. And what I like with Europe is that we have these common rules, but somehow on the detail level, and that's something which we experience in TEF-Health, is that people are doing that differently. So it's really, and it's also what companies are saying, we want to have clear rules, what to do, and do it really on the ground level. Are there any activities from all of you that you're seeing where are best practices, where we can learn from each other, where we can say, okay, this is really a faster approach, a fast track, that we can make the transfer much faster than we have done in the past?
I think from my perspective, the main takeaway that I can give in my role is the one that I talked about during my presentation, and that is the sustainability of the TEF-Health project. And this is something that is being outlined right now, and it's not up to us in the government institutions to decide on how this should be done. But as we see it in Sweden, EDIC is discussed as a potential way forward, and this is why we decided to sign a letter of intent in order to give the Swedish node an opportunity to continue to explore this opportunity. And of course, more member states need to make the same decision to enable to keep this moving forward. I'm not sure if this was an answer to your question. Partly. Maybe you can do a...
Maybe I can... What I can add is that when we talk about regulatory sandboxes, and especially regulatory sandboxes as there are in the AI Act and as they will be coming with the MDR, is that there will be a European oversight. And these regulatory sandboxes, they are supposed to work together, even though they don't have to, but it's highly encouraged. And they need to report to the EU AI office, for example, so they can come up with these guidelines and can make sure that they are aligned across Europe. There will always be some differences, but there will also be, once one company moves ahead, like Sweden has now moved ahead with the MDR2A classification for AI scribes. I'm pretty sure other member states will come up with similar recommendations so that it will spread. Somebody has to take the first step and say, okay, we dare publishing our guidelines now, and then other countries can say, oh, this is something that we can go along. And I think Sweden made a really nice move there, by the way, with this publication, and I think we all should follow the lead and take similar approaches.
Yeah, if I may say something from...
Just closer to your mouth.
Maybe this one is functioning. What is experience from my country? First, there are various companies. There are really small startups that are surprised that they will possibly need certification. So there's layered information. That means first is just explanation what is needed, and then for the advanced, of course, it's more complex. But what we did in my country, it was support, particularly for certification, which is quite unusual. That typically in research projects or in other innovation projects, there is a typical exception that you cannot finance certification because it's things you are obliged to do by law. That means we had dedicated program managed by Ministry of Industry and Trade for companies, including AI in healthcare. That means tools developing by small companies for healthcare that applied, and a significant part of the expenses or costs spent with the certification were covered by this, so they were quite happy by that. And also there are other programs organized by other agency called Czech Invest to support small companies like startups for very specific activities. I am not sure whether it's simple to change the existing ways. That means the procedures for certification. It's quite challenging always because it needs consensus of all the actors. We have several notified bodies, and there are also notified bodies abroad, and so on. So it's not so easy to implement something like change, but to support, we found that there are two elements that the companies always ask, data and the certification expensive, so some support for covering the clinical studies or the certifications or conformity assessments. So this is the way. So possibly it's similar in other countries, but I found that it really helps to concrete companies. That means to have support in financing of the some parts of the certification. Regarding the data, it's more challenging. I am EHDS. I work on EHDS. That's my major scope of work. So I see that this might be way, but it's definitely not easy model. It's not something it's not a simplification. The process in EHDS in terms of secondary use of health data, it has some some rationale behind that, because we must overweight the necessity of consent. Patient usually have expressed consent with the use of the data. But in HDS, there is no consent. That means it's overrated by quite complex procedures. Assessment, it may take months and even longer than 3 months. And therefore, it's not a simplification as such, but it's unification in Europe. That means it's unified approach. Hopefully it will be successful. That means in all the European countries, we will have equal approach to making the data available, of course, through the EHDS, because there may be also other ways, but definitely EHDS is one of the, let's say, preferred ways in Europe. So that's my contribution to this.
Thank you very much. And I think Fidelia has something to add.
Yes, thank you. First of all, I would say that if we are able to integrate all the activities to support the AI manufacturer and provider within the framework, this will facilitate a lot all the processes and will increase the speed of the processes. First of all, because all AI is based on AI, on the availability, on data. So it is needed the very quick access to data, and if the TEF-Health nodes and networks will become parts of the integration of the health data ATU network, all these processes will be significantly facilitated and also reimbursed for the activities through fees, which are of the HDS regulation and framework. And secondly, because if we have the HDS framework that as the regulation is something very specific to the healthcare sector and very clear in the governance framework, we can integrate more easily all the other regulations, for instance, all the requirements based on AI Act, which is horizontal in different sectors, so not specific for the healthcare sector, and other regulations which are more focused on requirements and not on governance, as for instance, medical device regulation or health technology assessment regulation and so on. So if we are able to integrate all these elements within the HDS framework, within the health data ATU networks, at the end also the AI manufacturers and providers will benefit from the standardization of processes. Finally, in member states where there is a universal coverage of healthcare provision, at the end the AI tools which are part of the healthcare provision, so at the end in a post-market phase, could be part of the reimbursement processes which are related to the provision of healthcare. I mean, for instance, if we have an AI-based medical device which is part of the provision of healthcare for the specific group of patients, and it is routinely used in the clinical practice, it could be reimbursed at the end, and it could be facilitate the sustainability combined with the reimbursement that we have in the pre-market phase during the preparation of these tools, which is part of the European Health Data Space Network.
Thank you very much. And as much as we would love to take the remaining 4 questions, but in the interest of time, we would unfortunately not be able to. But during the break, feel free to engage with the speakers individually and continue the discussion. Apologies for that. And thank you so much for your time and for sharing with us. I think, Malin, you can stay back, but yeah, the rest can go because you're in the next panel discussion. Yeah. Sorry, Jonas, you also to stay back. No, okay. Great. And so moving on now, we would move on to panel discussion where we would be hearing from the member state also. We would have representatives from the member state. And the panel discussion will be chaired by Omolola, who is the Belgium node lead on TEF-Health. And also joining her on stage would, of course, be Malin, also Lukas, Yanura from the Ministry of Economy, Chechnya, Sasa also from Sitra in Finland, and also we'll have Ole, the Chief Medical Officer at Vithalint, Norway, and also Fabio Pianesi from Italy. So yeah, over to you, Omolola, I think.
I'll just take it.
Great. Thank you.
Hello. Can you? Yes. Good morning, distinguished participants, speakers. So it's now my pleasure to moderate this discussion. And Malin, thank you for agreeing to be both a keynote and a participant to this panel. Maybe we can start with a short introduction because the other speakers are not known yet to the public. So yes, please, Lukas.
Hello, if I may start. Good morning still. I'm Lukas representing here both the Embassy of the Czech Republic in Berlin and also the Ministry of Industry and Trade of the Czech Republic, dealing with companies, the most time their support on foreign markets, but also in our country from various fields, including this high innovative field of AI in healthcare. Thank you for the invitation.
You already know me,
Yes.
so I don't need to say something.
Hello, my name is Sasa Kivisaari. I'm from the Finnish Innovation Fund Sitra, which is an independent public organization under the Finnish government, and we fund and support initiatives for the Finnish future, including sustainability, healthcare, and sustainable transformation with AI and data in particular. So very nice to be here.
Yeah, so my name is Ole Christian Thu. I work clinically as a consultant in anesthesiology and intensive care medicine in Norway, but I'm also here representing Vital Things, having the SME perspective of scaling technology, AI-based algorithms. We have different types of technology and collaborations with other companies where we are focused on documenting key performance indicators, technology in use in different member states, and also delivering a lot of algorithm licensing and technology to global universities. So I'll take the perspective from the SME side, and also as Norway being an EEA country, I'll also have that in mind as well. Thank you.
Hello. First of all, thanks for having me here. My name is Fabio Pianesi. I'm distinguished fellow from an organization, a research organization in Italy. Basically, we have been the first AI research organization in Italy at all, and we've been instrumental in establishing European AI since the 80s. I've been, and I am an AI person since the beginnings, and left active AI research some 15 years ago to devote my activities to AI innovation, so basically concerning with bringing AI to the market, startups, etc. One of the reasons I'm here is that I've been quite recently heavily involved in the establishment of EDICS. So I'm part of the board of one of the established EDICS as of now, which is the Language Technology EDICS. And I come from language technology, so that might be one of the reasons. And we have just recently submitted all the application for the Agri-Food TEF EDIC, which, by the way, is a sort of cognate to the EDIC that we've been discussing today, because it starts from another TEF, which is the TEF Agri-Food. So hope that to engage this with more information about this topic.
Thank you very much, Fabio. So in this panel, we'll try to have micro, very focused angles, and more macro, less focused governance angles. So moving on to very micro, and I'll start with you, Ole. As you said, you have a bit of a different perspective here, representing an SME and a non-EU member. But my question would be really at SME level. Currently, a lot of the testing of AI solution in the clinical setting is done, by individual clinicians that are motivated, that are really wanting to move forward the solution. But this is, of course, quite tricky in terms of sustainable, in terms of driving impact, because done at the individual level. So it would make sense to try to have this done more at an institutional level, more at a hospital level. How would you, incentivize? And this is building a little bit on the previous discussion. What's the business model? How do you incentivize hospital to kind of take these on their shoulders, so it doesn't rely only on the shoulders of individual clinicians?
Yeah, thank you. So what we're talking about here is that what we often see in different type of hospitals is the enthusiasts. And from the company perspective, we call them early adopters. They are key and critical. They are innovative. That might be a person. It might be a department. It can be a hospital, rarely, but usually it's a smaller level. And they are identifying opportunities and want to act upon them. The challenge with that is that since they are moving ahead of the organization, they often lack the proper anchoring of the entire organization, the procurement, the IT department, the data protection office, and all of these aspects. And what we're really talking about here, to put it into perspective, is that the title of the summit here is Transforming Healthcare. And what does that actually mean? Well, I'll be very frank and say AI is absolutely useless, and I gasp, until it's actually used, because that's the remaining step that's often unaddressed. So we're talking about three different type of elements here. We're talking about data access, hugely important, leveling the playing field, ethics. It's critically to be able to actually develop technology. It's the regulatory support and pathway where we see multiple companies fail. Those two combined can facilitate the process. But trust me, being on the receiving end of the MDR certifications multiple times, it doesn't help you at all. There's nothing magical happening once you have the MDR approval. It's just a formal prerequisite, because that's where the actual journey starts. I would say it's over 50% of the work is the sales process and the scale process after the MDR approval. Getting the MDR approval, it's a milestone. It's quite boring. It's a PDF. Nothing magical. The point is that it's vastly different from other type of technology and procurement process, because if you take it into perspective, taking a new respirator can be a fantastic innovation, but it doesn't disrupt the entire hospital if we buy something new. It can be some new algorithms, some new improvements, some new user interfaces on the respirator. It's still a respirator. What we're talking about with AI is disruptive innovation. It's making something entirely different. And as we all know from hospitals, they are not very good at changing their identity and who they are. And that's the key issue. And that brings us down to what do we need to document together with the enthusiast is how does this play into your local hospitals? Because this is also dependent on the culture of the hospital. What type of hospital are they? And trust me, they are very different, even here in Germany. And I think if it was up to the German hospitals, there's 1,800 of them or something, I think they will like to do the local documentation of effects on every single one. We'll likely have colonized Mars until we're done with local documentation just in Germany. So that's the frank assessment. And then the question is, how do we actually move from that in terms of the incentives? Well, I think we need to move fast. As also stated in the beginning, I think we don't need to invent a new type of incentive system. Let's use something that's already in place. And being on the panel here, going directly against the German directorate, that's a good start. But I actually think that we should use the incentives that they already have. The DRG, the procedure incentives, where they actually get direct funding based on the activity they have. So thus the patient is a part of an AI-based effect documentation on an organizational level at the hospital. Well, let's give the hospital some incentives for that activity, as we do with remote telehealth monitoring for heart failure patients. Let's keep it simple and let's start, because the challenge is really showing the organizational effect in the hospital and not just algorithm performance and sensitivity and specificity. Thank you.
Thank you very much. And so still building on this interaction of the hospital and the SME, Lukas, you said that you really wanted to focus really on SMEs on this panel. Something that could make a difference is if hospital would be willing to fund like pilot testing study, and because not so much for the amount of money that they would be paid to the actual SME, but of course because it would be a major signal to potential other investors, and something that SME could showcase and say, there is actually clinical interest. Otherwise, the hospital would not have paid, even though the amount is not key here. So we realize that this is not only about health, it's all about the economy. And how do you make these two different units or approach work together?
Mm-hmm. I would say not only in our country, but in many countries, it was already stressed during the previous debate here, hospitals are generally willing to get started, to promote something new. But then there's a question of sharing the institutional, sharing the whole administration burden within the institutions, which, according to my experience, bigger facilities tend to do it better within the system. I mean, hospitals and bigger facilities and bigger cities and of course in bigger markets. And then I was thinking about our advantage bordering with even bigger countries, Poland and of course Germany. And you probably know that there's a huge tradition of many scientists and also many doctors and staffs working abroad, especially in the bordering regions. So there's kind of natural cooperation. So maybe for a smaller market, the solution could be to focus on in broader contact abroad, and to start like this. However, we have increase also in testing in bigger facilities all over in our country. The increase in the last 2 or 3 years is quite promising. So I think there are mechanisms even in our reality. A general concept, I don't know, but definitely it could be to start with bigger structures. Definitely would be my simple recommendation.
Well, actually, that's a nice transition to the necessity to work cross-border and to maybe even seek bigger markets at the start. So the issue of scaling, I would like to quote here a report that was published by the Commission this year that was undertaken by Capgemini and IDC on an observatory for digital health technology in Europe. And one of the recommendations is precisely strengthen the EU digital health market. Okay, this is not only AI, but still also applies for AI. And one of the recommendations is joint procurement mechanism, mutual recognition of certification, streamlined conformity pathway to reduce duplication and accelerate time to market. And the question I would like to ask you, Fabio, would be, could the EDIC address some of these obstacles as you've been working on these consortium? And so maybe not mutual recognition or certification, because this implies other parameters on which EDIC might not have a full control over, but issues such as joint procurement, for example. What would be your views about this?
Well, EDIC stands for European Digital Infrastructure Consortium.
Yeah.
So their business is to either build or maintain, bring to the market digital infrastructures. In the case we're discussing today, there are plenty of digital infrastructures that will be more or less floating in the air in the coming future, which are the data space, the health data space, the infrastructures built by the TEF, which has been built by the TEF, and by digital infrastructure. We should not, when we talk about that, we should not forget all the skills and competencies in setting them up and managing that have been built by the different consortia. And in addition to that, the network of potential users, potential clients, customers, whichever way you want to call them. If you do not put them in a safe place, this all will be simply vanishing, okay? So we should start thinking about these digital infrastructures as if they were sort of public goods. And especially in a sector like this, it is important, being them public goods, that you have, in order to manage them, in order to secure their future, the involvement of member states. That's why one step after the other, we land in the realm of the ethics. ethics are legal entities. They have a legal framework. What is important, whichever place in Europe they are established, they have ample capabilities of operating in all the 27 countries and associated countries. Sorry. They have their own governance structure. Therefore, they have to elaborate and then have approved by their governance their own industrial plans. So you start having the framework for putting all this infrastructure on the safe side and giving them the future. Whether they should engage in procurement, this is another matter. At present, I would say no. What I would say is that who are the clients for these ethics, for this infrastructure? First of all, developers, of course.
Developers.
Developers all over Europe. And here there was no time, but an interesting question would be that what's going to happen to the interplay between the 28th regime, which sometimes will come into play, and the incredible segmentation of the health market in Europe. This is another question that the headache could help overcome exactly before all the relevant actors, in particular member states, are in the driving seat. So that it can play an important infrastructural role. It is important not to overdo it, but an important infrastructural role. And concerning the business model, then we can discuss this at large, but it must have its own business model, otherwise it would not survive. I think this is enough now.
So yeah, so thank you to put again the focus on the infrastructure, and me being very stubborn, I go back with the funding issue. You know, listening to also what Medimi has told us about what SME can do and not do, and so the issue of funding, and that was another recommendation of the report. So you know, you have to boost frontier technology innovation by prioritizing funding and procurement initiatives in underrepresented but strategically vital domains such as AI diagnostic, genomics, and cybersecurity. And of course, this requires significant funding from the member states' perspective, and this is where Sasa I would like to ask you, and I see Fabio going. So, and please feel free to interact. I mean, this is a panel discussion, so no. But you know, and when I say significant funding, also is because more and more member states want also to rely on, or less rely on non-EU vendor solutions, so this has a cost also. So pooling resources, avoiding duplication, what could be done about this, in your view?
Yeah, so coming from a funding agency, at Citra, we really believe in public-private partnerships, and we believe that by fostering this ecosystem, we can grow more competitive while we are tackling the real life challenges that we have in our society and public sector. And I don't see the problem so much as being about the sort of size of the investment, but rather that the investment might turn fragmented, and that's something that we need to avoid. And currently, I think we can all agree that that many regions and healthcare organizations and public authorities are essentially using limited resources to tackle the same problems in parallel. And when one of us solves the problem, then it oftentimes the best solutions stay local. And this means also that we are not getting the return for the investment that we have made. And this duplication of work really spans from the technological development to procurement also, to the ways we do training, the ways we interpret the legislation, the regulation, and the way we do impact assessment. And I think there's so much we can do better here, that we can sort of save our resources from doing the same things all over and over. And this is where I think scaling is the key, and it's really also where the interests of the private sector and the public sector are very intertwined, and where possibly ethics can help. So when we scale efficiently, the public sector essentially stops paying for the same learning process many times over, and importantly, that also builds the sort of system where our companies, our European companies, can grow. And the challenge is that we're sort of assuming, oftentimes, at least in our experience, that scaling is something that just happens organically when there's a good idea. But in our experience, it doesn't. It requires a different kind of investment, different kind of funding, different kinds of incentives. But when we invest in scaling, then we essentially grow this shared capacity. So I think in the short term, we could see this as a portfolio of smaller but serious, strategically important use cases that we scale very determinedly across Europe. It doesn't need to mean like one specific product, but a family of products built to solve a need that we have. And when we do this, we also unlock the ROI for the investment that we make.
Mm-hmm. Thank you, Sasa. And now kind of bridging what Fabio said about what edX allows, to keep the work that has been done within the TEF, for example, the infrastructure, not to lose the network, not to lose the expertise, and the necessity of scaling that you just emphasized. Malin, in the previous presentation, you explained a little bit why Sweden was the first mover in a way to kind of give this letter of intent. According to you, and you touched upon this already, but maybe it's worth repeating it, why also there is an interest to be an early mover from a member state's perspective this time, not from the advantage that it does bring to the TEF in not losing the work and not losing the expertise, but from the member state perspective.
Yes, thank you. Yeah. But as we see it from our perspective, we have already invested so much in this project, and we have seen real contributions, very valuable results. And it wouldn't make sense that there's no way to contribute or to continue building on that. And this is something that is often discussed also at the European level, the problem with the project death, that after a project ends, all this expertise, the network and everything gets lost. And this is also why what the ethics are intended to solve, to create more long-term sustainable solutions to continue these types of infrastructures. And for us as a member state to be able to have an influence on what is done, it's important to be there and engage early on, and to have an influence on a possible future EDIC. So therefore we see that it's important to join early, but also to see it's by signing a letter of intent. So also we say that we are committed to continue this work and to see where this is going.
Thank you. And so also going back now again to the SME perspective, there is a lot to be achieved by this cross-border collaboration. We've just seen from the perspective of the creation of the EDIC for the expertise, the infrastructure, from the perspective of the member state for the return on investment. But for example, touching from the SME perspective now, what we would like to avoid is the fact that an SME would need to, in its validation path, start all over again each time that it approaches a hospital, and maybe the necessity not to focus only on the performance of the algorithm, but actually on the impact and the clinical impact, and for this to be shared among different hospitals and therefore member states. So going back to this SMEs perspective, how currently within the TEF, for example, we have a TEF-Health hospital task force, but right now this is really it's giving the possibility for one SME to dialogue with multiple hospitals at once. That was introduced by Petra, but how could we go a bit more ambitious and not be only a dialogue, but really like kind of a validation? Sorry, it was a long question.
Yeah, thank you. I'll keep a focused answer. I think this is the key. Also circling back to what is the end goal here in terms of transforming with AI, it's to actually improve the healthcare system. It's actually to make it more sustainable, avoiding that personnel factor that we know is unsustainable. But it's also important to be very aware that the data requirements for an MDR approval, when you're inside the hospital, you're proving that your algorithm works, that's not the same data requirement for scaling. That's different. And that is due to the fact, again, because of the cultural differences. The chief financial officer of a hospital, he doesn't really care about the algorithm performance. He wants to see how it taps into his organization, his staffing factor, his hospital IT infrastructure with actual measurable results in terms of length of stay, diagnostic accuracies, improvements in anything that's a matter to the hospitals. And the challenge is that since it's a cultural aspect, it will vary logically between a teaching hospital, a university hospital. Charité Berlin has a different type of environment than Bundeswehr in Ulm or Albfils in Göttingen. It's different type of cultures. So what I think, and it's also varies between the countries, but there's also a solution to this, and that is which I would encourage, is that the member states actually identify that this is a fact. We need to have a system in place to make sure that once you document actual value that can scale in one hospital, it's not possible to scale, it's mandatory. I would flip it around, and that means that you need a cross-section of representative hospitals. You need some teaching hospitals, you need a university hospital, a local rural hospital, a different type of countries, and those are the cross-sections. And I would especially fund them, again, with DRG or procedure codes that are instruments today, and incentivize them to be part of that documentation, and the data access and the data that brings should be recognized across the other type of representative hospitals. So it's a complex issue, but it can also be solved very concretely. It's not abstract.
Yeah, so it's a little bit also what you were describing earlier, Lukas, the necessity for these cross-border collaboration and again, here we speak also the access to data for SMEs. From your point of view, we've mentioned here the European health data space. How do you intend to help, SMEs in precisely having this access possible, or?
Mm-hmm. Again, maybe I'm just now thinking about our successful examples. One of our companies, CareBot, is now much stronger abroad than in our country. However, it still now it's being used, this software, in more than 100 units and hospitals also in our country. And there were several keys of success. But again, if we want SMEs and rather small startups to be successful in this way, we can maybe alleviate at other levels some burdens can we take off, and I'm watching carefully what's being done in Germany at the federal level. What are the announcements for the coming year? What can generally make the business for SMEs easier? But the other question is also and it was something what briefly touched my colleague from the Ministry of Health of the Czech Republic already, to guide the smaller companies through the process from the very beginning, and maybe even before that, at the level of idea, because they can never go back and design their whole path again once they realize they need 2A certification, etc. They can never return. So from the very beginning, starting with the ideas, is to have in their minds exactly the right business cases, etc. Maybe that should help, and that's one of the success stories regarding the already mentioned program of our Ministry of Industry and Trade, where also the guidance and in combination with some financial support for the certification itself could be among the keys. What will also, if I look at the most successful small companies in our country, 4 or 5 ones, their focus is in general and broadly used methods, chest X-rays, retina diagnostics, etc. No complicated small niches. Mm-hmm. The question is why? Again, sharing of risks, of burdens, big numbers, and a bigger chance to touch also in bigger consortia the neighboring countries. My remark to the topic EDIC, we have very good experience regarding EDIC in other fields already. For example, our laser infrastructure, etc., everything connected with this structure was very successful already. So my hope would be that even in healthcare, it can help.
Thank you, Lukas. Before we wrap up, just one other question that I'll just ask each one of you your final thoughts about the member state perspective on transforming healthcare with AI, robotics, and data, and also the use of the EDIC as a vehicle to address this transformation. But before we do so, I wanted to ask you a question, Sasa, about so as the chief medical officer of La Charité said earlier, we have an aging population, and then we have also rising chronic disease rates. This is driving up demands, but at the same time, there is a shortage of labor, and this is putting constraints. So, of course, we need to invest in healthcare, but there is a lot of hope that's put on innovative tools, and AI is one of them, to bring resilience to the system and also to bring operational efficiency. But in order to be efficient at operational level, you have to ensure that you speak the same language. This is true in other sectors that we unfortunately witness nowadays in defense, but it's also, of course, true for healthcare. And there is actually a recommendation of the OECD report saying, we should ensure consistent interpretation across the European Union, promote uniform application of AI-related rules through centralized guidance and regulatory coordination mechanism. In your views, how could we achieve this?
This is a very tangible issue in Finland. According to some estimates, 1 out of 4 Finns will be over the age of 65 by 2030. So it puts a huge burden on our health service, health system, and also has really forced us to think about how we can enable responsible AI at scale in a way that supports the capacity of our system and the resilience of our nation. We have found that this uncertainty around legislation is actually one of perhaps the single biggest barrier currently across organizations, but also authorities. So it's a situation where nobody really knows how to get around this. And it slows down implementation, and it causes duplicate work, and maybe the biggest problem is that it causes this risk avoidant type of pattern where nobody really dares to take up some of the most promising AI applications. And we talked about these incentives in the earlier Q&A. Legislation, I don't think legislation is sufficient, or having perfect regulation. I don't think that would solve this problem. I think we do need stronger collaboration, stronger structures between our regulators and healthcare actors and innovators, ways of bringing all of them together in a way we haven't before. I do think that sandboxes and ethics are definitely some of the critical structures that we need for collaboration, and we probably need different kinds of frameworks also, like using these different kinds of sandboxes and different kinds of ethics, and to support responsible implementation. And not only that, we need ways of disseminating the outputs in a way that they can be translated to shared guidance, best practices, and then feedback back to the regulators and legislators. And we need these to disseminate these in very practical ways, because currently I think we're really risking putting the burden onto our clinical professionals and the clinical organization, which risks sort of washing out the gains that we are hoping to get with AI. So this is a really pressing problem, I think. And I do think that we need to tackle this issue around interpretation around system level. And once we tackle that, I cannot give you answers on how to tackle that, but once we tackle that, then that means that we can also implement AI responsibly at scale.
Thank you very much. Thank you to all of you. And so before we leave the stage, could I ask you, maybe starting with Fabio and moving in this direction, a final thought on, okay, what do we do next?
Okay, answering very briefly to a question that you, in a way, already asked me about the funding.
Yeah.
So, okay. Well, ethics are legal entities, and they must design their own business strategy. So the money from the member states only for the basic functioning. They can participate in any type of calls from the European Union Commission. And for those who have already had a glimpse at the recently published Cloud and AI Act proposal, ethics will have a major role in implementing the so-called frontier AI. And I think there's plenty of opportunities for an ethic concerning health in thinking about having a role there. And this is not last, but of the utmost importance, revenue from services. I mean, if you build, manage, and deliver infrastructure, digital infrastructure, this can be done at a fair price. So an ethic can solve its problems in ways that a normal project, of course, cannot, because it does not have the time frame, does not have the capabilities, does not have the resources, etc., etc. So there's plenty of ways for which an ethic can be a sustainable way to maintain infrastructures that have been built with public money, because this is what we're talking about.
Thank you, Fabio. Ole?
Yeah, I think concretely, I would say that it's a funding issue, but it's not in terms of the volume of money, because the funding we put into healthcare system is huge. It's a pit, insatiable. You can't fill it up with money. It's more on increasing the precision of where you use the money. And again, it's identifying which hospitals we want to demonstrate the scalability in across the member states, and then it's incentivize them. We have the instruments in place, again, with the DRG and the procedure codes. All the instruments are there. It's more of starting to play the music. This can go really quick. Very brief illustrative example in Norway. The health ministry was concerned that there was so much glaucoma, like high pressure in the eyeball, and they introduced a small tax, 20 euros, if you measure the pressure in the eyeball at the primary care office, and then it just exploded. So every person in Norway almost was measured, so it kind of went over the hill. But still, these are the instruments in place. The hospitals do respond to them. It's not difficult to actually get this data that needs to scale. It's more of using the instruments that are already in place and prioritizing also scalability, not just reaching the MDR certificate, because my final remarks is it's not a magical thing. Nothing magical happens with the MDR. Thank you.
Thank you. I have to agree with Ole, and if I needed to pick one single thing, I would say that it's solving this paralysis around the interpretations of the regulation. And concretely, I would think that funding into sandboxes in a way that they would support both the compliance part, reaching the MDR, but also the real-life adoption.
Thank you.
Thank you. I would like to finish off by saying thank you to all of you who have shared your perspective and your knowledge in this field here today. I think it has been really valuable for me to listen to all of you, and because in my day-to-day job I work more with a helicopter perspective with many different projects, and here today I have really come to understand even more on the importance of the projects that you are working on here. And I think me and my role as a government agency representative, my role is to help you to do the work that you are doing. And I think that one way to do that in a good way is for me to have good communication and dialogue with other member states representatives to learn from your perspectives, and we can discuss the way forward. So I really look forward to continuing those kind of discussions. We have already started with some having these discussions on ethics and letter of intents with our neighboring countries, colleagues of you in Norway and Finland, but we also want to continue the discussions with other countries. So thank you.
Okay, I would also like just to thank you and for your attention and for the invitation as well. My brief remark would be almost the same. Like, stay in touch from people from different fields like this, because I'm not. I'm not an expert really from the field of healthcare. Especially, I learned several new points today. I'm always thinking the basic set of problems is very similar in every European country, and the solutions could be totally different. I know it from other fields, and you mentioned sandboxes. We are dealing also with sandboxes in the field of energy, gas infrastructure, for example. So it's maybe a similar setting of problems, yet in a totally different context. It's always very, very inspiring for me, and thank you again.
Thank you very much. Thank you to all. So we've learned that nothing magical happens with compliance with the MDR, but maybe something magical can happen if we continue to work together and exchanging our practices, so that helping SMEs to scale. Thank you. Thank you to all. Thank you to the audience.
Thank you very much, Hannah-Laura, and our panelists. It was a very insightful discussion. And I think a key takeaway from this, one of the key takeaways from this discussion for me is about the shared recognition that Europe has already invested significantly in building these infrastructures, networks, and support mechanisms for AI innovation. And now the discussion should be how can we ensure the long-term sustainability and impact of this project? So basically, return on investments of the public money already invested in this project. And I think also a recurring theme was the important role that such initiatives as edX would play in ensuring that sustainability in getting that return on investment. So, it was a very nice discussion. So thank you once again to our panelists. And now we would be moving on to our keynotes. And to start off our keynotes, we're going to invite on stage Dr. Severin Fischer, who is the State Secretary for the Berlin Senate Department for Economic Affairs, Energy and Public Enterprises. Yeah, so over to you, Dr. Severin.
Well, ladies and gentlemen, wonderful morning. It's not anymore morning. Wonderful day today, and thanks for having me here. And first of all, thanks to Professor Ritter for setting up and organizing today's conference here. And I think looking at the program, it's already quite tough this morning, discussions on very complex topics, and therefore I would try to be brief. And first of all, thank you for taking up the opportunity today to speak here in Berlin. I think Berlin is the health capital in Germany. And I think looking at the program you had this morning already, it's quite clear that the transformation of healthcare and at the same time, the issue about a better connected Europe is something that takes not only one day to discuss in such depth. I'm very pleased that, and really would like to express my gratitude to you, that TEF-Health and the Berlin Institute of Health at the Charité have met together, started the TEF-Health project here in Berlin, and already said Professor Ritter has, I would say some outstanding work in the last couple of years done here, and this I think also shines to a very bright debate beyond Berlin borders, basically towards a European discussion. And I'm also happy to have today the European Commission here. That's a great opportunity to discuss with you also how the future of the project has been set up, what we can do in the coming years, and of course also the OECD, where we will have an intro and keynote online here. Well, why meeting here in Berlin, and why Berlin is a great place for your endeavor? Well, I think, as I already mentioned, our city has evolved into one of the leading European hubs for health tech and AI in the recent years. And that's not a coincidence. I think it's a result of a dense and unique scientific landscape. And we have here in the city 4 universities, 39 universities of applied sciences, and over 70 non-university research institutions. And therefore, this here in the city is one of the highest concentrations of researchers in the world. And I think this has great implication for what we can do, what you can set up. And this meets basically a startup community as a second key pillar for this. In the last decade, we have around 4,000 new companies being built here in the city, startups, a national incubator, and if you look above all Germany, it's around 1/5 of the newly founded startups that are born here in the city. And what makes us especially proud is the internationality of the whole scene. More than 40% of the employees we have in our startup community come from abroad, and I think our ecosystem lives from the diversity, and that's just not just a buzzword. I think it's the core of innovation here in the city. Diversity, international outreach, and this leads to an innovation system that really has to find, or is hard to find a comparable system, at least in Germany, probably in Europe, it's hard to see that. And we, as the Berlin Senate, we have followed this track for many years, and next week we will for the first time set up a deep tech Berlin strategy. It's the first kind of this strategy we've done. The first time a city, a region in Europe, I think, is putting up a dedicated strategy for deep tech innovations. This agenda will align with the strength here in the health sector, that's quite clear, and put it together with our AI expertise. And we are committed to develop Berlin to a leading global center for AI-based applications, and our aim is here with a deep tech strategy to make or set up Berlin here also on a global stage for the quality of technology, and at the same time for an ethical, high performance, and a system that is compliant with regulations. And hand in hand with that goes also something we are at the moment working on very hardly, that is the so-called Berlin Transfer Bridge. We're trying to set up a common system for IP transfer here in the city. And as I mentioned before, I think having this huge environment of universities, non-university research institutions, and at the same time an economic system that is trying to absorb ideas and innovation here, it is important to agree on certain conditions for IP transfer that will be key for further development. And I think, hope Professor Ritter has highlighted in her starting speech today, that is why we would like to focus on the strategic value of this project here, of TEF-Health, and why our administration and economy is very happy to have you here. For a health tech company, especially if you're a small, medium-sized enterprise, the path from a great idea to a certified medical product can be daunting. And the regulatory requirements that we face here are quite high, as human health and lives depend on them. And this is where TEF-Health comes into play. And we are quite happy that it provides a safe, real-world testing environment where innovations can be validated under expert supervision. This shortens time to market for companies while ensuring the highest standards for patient safety and data protection. And for us, TEF-Health is a prime example of how modern administration can support innovations, not by lowering standards, but by providing the infrastructure to meet them more efficiently. And when we look ahead, I think we must address the question of how we can preserve and further develop this valuable infrastructure. And the current phase of TEF-Health runs until the end of 2027. This is basically tomorrow. I think we need to work hard on how we can preserve these testing facilities that are not temporary. And it's a structural necessity, I think, also for the European health market in general. And for this reason, we, as the Berlin Senate, State of Berlin, we've initiated a discussion with our partners how to ensure long-term sustainability of TEF-Health. Our aim here is to transform the project from a time-limited initiative to a permanent, robust structure. I think this is really important for the economic system here in the city and the connection between our universities, our health system, and innovation. In healthcare, I think that is quite clear, is a prime example why we need Europe, why we need more Europe and not less Europe. No member state can master the challenge of digital health, I think, today by itself. We need the cross-border exchange. We heard that just on the panel we've just been listening to, and therefore the harmonization of regulatory process and the joint strength of our research landscapes is core. And I think today, the discussion you're having here, the summit in general, this is a vital part of this Connecting Europe philosophy. And I really do encourage you to use this day to deepen your networks, to challenge existing ideas, forge new alliances, and I can say that at least to our international guests, but also, of course, to our guests from Germany, beside all the discussions you're having here and the important step forwards you're approaching, take your time also to enjoy the city. Berlin is always worth a journey here, and I hope you get in touch with some of the things I just described, a very diverse, innovative society, and I hope you enjoy your time here. But overall, I hope that you develop a future also for TEF-Health and the structures here in Berlin. And I congratulate you to the conference today. Looking forward to the keynotes now and then having a break. Thank you very much.
Thank you very much, Dr. Fischer. And that was, so I think a lot of us are probably itching a bit for the break. But before we move on to the break, we have two keynotes. And now we're going to move on to the European Commission. And I would like to welcome on stage Stella Raini, the head of AI, Health, Life Sciences, DigiConnect European Commission.
Good afternoon. I think it's afternoon already, so and thank you very much for the invitation. I'm very glad to be in Berlin today. I would, first of all, I was very happy to hear the conversations this morning and the very interesting interventions. And I can say that when we look at the bigger picture and the strategic plan of the European Commission, we have the so-called AI Continent Action Plan that the Commission put forward a little bit more than a year ago. We can safely say that the TEF-Health and eBRAINS infrastructure are very well positioned in this bigger plan. There are, under the 5 pillars of this plan, healthcare is very well represented. First of all, when we look at the support for computing capacities, the Commission has selected 19 AI factories. These are high-performance computing centers optimized for AI. And there we have at least 15 of them who are able to accommodate use cases in health and life sciences. And the next step will be to invest in so-called gigafactories. And there we are looking at 20 billion investments in the near future. Looking at the data side, we have been discussing a lot the European health data space, which is really a major enabler of health data, making available health data in the near future. And we have also been supporting in the past years health data infrastructures already before the European health data space was put into place. We have the genomic data infrastructure, Cancer Image Europe platform, intensive care unit data space, and also the advanced platform for virtual human twins and the eBRAINS infrastructure. So we have been working on health data quality a lot, and TEF-Health is also very well complementing this landscape of bringing high-quality health data into the picture of training AI algorithms for healthcare. And also there is the concept of Health Data Lab, which is about bringing the data to the AI factories. And this is the new concept that was brought forward recently in the in the data policy part of the European Commission. Then one very important part of this picture is about skills. Also, the AI Act talks about AI literacy, so there is really, it's an obligation that we are also training the healthcare workers and all the actors around who are there when AI models are built, that everyone has the necessary skills. And the AI skills are supported from several EU funding programs, EU for Health. There is a policy program called Pact for Skills, and most recently, the so-called AI Skills Academy that was announced as part of the AI Continent Action Plan. And this academy was concretely launched in May this year. And also under the Digital Europe program, we are supporting concretely advanced digital skills also for healthcare workers. We have been talking a lot about regulatory frameworks, the AI Act, MDR, IVDR, and there, of course, the aim is to have legal certainty and clear, risk-based and clinically aligned rules for safe AI in healthcare. That is one of the pillars of the AI Continent Action Plan, and really in this commission we are aiming at streamlining the regulatory framework and making sure that companies have one entry point for certification, for example, and to have support services also. And there again, TEF-Health is playing a role with that, and also with the AI sandboxes and the support services for regulatory compliance. Finally, the fifth element of this strategy is the so-called Apply AI strategy, which is the part which is about bringing really the AI to the clinics if we are talking about healthcare. And this strategy was published in October last year, and it has three main sections. One is about sectoral flagships, where healthcare is one of them. There are 10 sectoral flagships, and there we are really talking about harnessing the transformative potential of AI by really driving the adoption of AI across these sectors, not just talking about AI, but really concretely bringing the AI to the real world. Secondly, we are tackling the cross-cutting challenges across all sectors by supporting SMEs, enabling the AI-ready workforce, and ensuring trust in the market, for example, and leveraging advanced AI capabilities, so also pushing the state-of-the-art of AI. Thirdly, we are addressing the governance mechanism by creating the so-called Apply AI Alliance, which is a forum for policymakers, industry, academia, and civil society to have a forum for discussion and exchange of information on developments of AI, application of AI, and then also we need to observe and track the progress and have insights on application of AI, and for that we have created so-called AI Observatory. We have 4 major flagships in healthcare under this Apply AI strategy. And the first one is called European Network of AI-Powered Advanced Screening Centers, and I was listening to the discussion in the previous panel, and there was this comment about, we should have hospitals, like a group of hospitals, early adopters, and they should discuss how to implement AI and agree and have maybe some common agreements. And actually this is what we are doing with this network. So we had a call for expression of interest this spring, and now we have 270 hospitals who have enrolled in the network, and they come from 24 different EU countries, and also there's Norway, for example, is also there. we had the first meeting of this network, and the purpose is really for the hospitals to exchange information about, like, concretely, when they deploy AI, what are the needs, what are the use cases that they have, how do they do this concretely, it's about exchanging information and best practices, and not to reinvent the wheel. And we want to sort of this network to also decide themselves what would be the best topics for themselves, what would be the most useful topics for them to, that the network, we are not sort of, the Commission doesn't want to dictate what the network does, but to make it as useful as possible. Charité is also part of this network, of course, and we are concentrating in the first place in cardiovascular diseases and cancer. We are supporting from Digital Europe program, in particular, medical imaging work and pilots in medical imaging. From EU4Health program, we have a major flagship on cardiovascular diseases with a strong AI support element. So it's only starting now, so the first meeting took place 11th of May. We would like, for example, TEF-Health maybe to be there to present as well, and the network of hospitals of TEF-Health to be there. And it's taking shape, and we would like to also see how to engage also with companies and to create like a network and create evidence for adoption of AI and as I said, not to reinvent the wheel, exchange best practices. So this is what my team is actually leading. So the first flagship, and the second flagship is about expertise on AI deployment. This is more about creating guidelines for AI deployment, and the first two flagships would be working together. So the evidence creation would happen in the first flagship, and the guidelines would be created in the second one, and they would be collaborating. The third flagship is about AI drug discovery challenge, and this is an industry-led topic in Horizon Europe, and this is about supporting SMEs in AI drug discovery. And the fourth one is about actions to streamline and enable quicker market entry of medical devices, and this action is led by DG Sante. So just to say that, as I said, this part of the strategy, this Apply AI, is a very concrete one. So we really want to be as concrete as possible, not just policy and abstract strategies, but have something meaningful and concrete that would benefit companies and health systems as much as possible, so that AI really reaches the market and the hospitals, because we have seen that the so-called last mile, like from pilots to the hospitals, this is the most tricky part. And it was said earlier that having the CE mark is not really, it's nothing. You really need to do the work to, the hardest part is to go and convince the hospital and to scale your system. Finally, a lot of talk was, we heard a lot of talk about European Digital Infrastructure Consortia, EDICS. Perhaps just to add that EDICS were created as part of the Digital Decade Policy Program, which is a program aiming at digital transformation of European societies with specific targets for year 2030. And this policy program is going to be reviewed this year, so some of the targets may be a little bit changed because of the changes in the economic and societal developments. And based on the assessment this year, there may be amendments proposed to the digital targets. And to deliver those targets, the Commission promotes so-called multi-country projects. And these are large-scale initiatives that no single member state can deliver alone. So this is really the thinking behind the EDICs. So it's something that a member state alone cannot deliver. And the idea of the European Digital Infrastructure Consortium this is something that the Digital Decade Policy Programme has introduced. It's a new mechanism, and the idea is to speed up and simplify the setup and implementation of these multi-country projects. We heard already that it's a legal entity, and it's established by Commission decision, and it has to have at least 3 member states and a Commission approval in order to go ahead. And the founding member states define the rules and statutes of the EDIC, like governance and voting and contributions. And the budget is based on the member states' contributions, and the budget can be complemented by other revenues, such as EU and national grants. And the EDIC's seat is going to be in one of the participating member states, and its legal personality will be recognized across all member states. And it remains open to other member states after it has been established. So it's not that once you establish it, it's there, but it remains open to other member states at all times. And it has to, of course, have fair and reasonable terms throughout the duration for all. And it can support both creation of new infrastructures and operation of existing ones, where the participation adds value. And of course, it was said already before, the idea is that we support with EDICs improved long-term sustainability. It's about moving forward from a project-based approach to something more sustainable, where member states are sustainably contributing to these infrastructures. And also it was said that these member states' contributions are there to help operate the infrastructure, but a solid business model needs to be built on top of that. It's not sufficient to have the member states' contributions, and EU funding. You need also other revenue models built on top of that. So this was all from me, and I look forward to talking to you during the lunch break. Thank you so much.
Thank you very much. That was another very insightful presentation. And now we're going to move on to our final keynotes. Then after that, you could definitely have a much deserved break. But we'll have joining us today online, Eric Sunderland. And over to you, Eric.
Thank you very much. And I feel like I'm really this event, and I think it's really fantastic to see the amount of energy in the room, fantastic to hear about the really leading approach that the Commission is taking around the adoption of AI. So I'm going to quickly go through some perspectives that we've developed at the OECD around the adoption of AI in health, and I'll give you some specific insights from a recent conference that we've held on AI in health, which again, I'll get to. For those of you, next slide, please. For those of you who don't know, the OECD, multilateral organization, really focus on the E and the C around how do we cooperate across countries for the economic development of those countries. It actually started out of Europe and then grew to this 38-member body organization where there are many countries that we work with, which are many of the leading economies around the world, but we also spend a lot of time with the emerging economies to make sure that we are providing appropriate support for them. As you can imagine, the emphasis and the work on AI and health specifically has been extraordinary in the last couple of years. But actually, even going back to 2019, the OECD was the first organization that published a set of overall principles for AI writ large. And since subsequent to 2019, many of those principles have been adopted by many organizations, customized for specific groups, such as in health. So we have this interesting, unique space because we think horizontally across all of governments about how to apply various policy areas like AI across banking and environment and public sector and in health. And what are the opportunities to learn from each other and what are the opportunities to accelerate growth? And with that, next page, please. Really gets to the overall approach and that we have around AI and health. Flip on to the next page and then the next page. Yeah, and one more, and I'll say this: I don't need to tell this group what the opportunities are for AI in health. We know it is impacting all aspects of the health systems, be it from clinical administration through to robotics, through to better diagnostics, to the ability to do diagnosis, to better public health surveillance and resilience of the overall system. We know that AI is absolutely everywhere and can do a lot of things. But we also know there are systemic challenges, barriers in the way to the effective scale of AI across health systems. And these are some of the various insights that we gained from this recent conference, where we have, there's a lot of inertia, a lot of fear of replacement of what is going to happen to my job. What is we're trying to build AI, but frankly, we have very, very weak data foundations. In the first wave of digitalization in the last 20 years, we focused on the technology, not on the data. So what we did was we put technology, we digitized paper, but we didn't digitalize systems where we re-envisioned systems about how they would operate in a digital world where the major asset that was being created was the data that we actually had. So we have very weak data foundations, and our workforces are burned out because frankly, and this is actually something I got from research I did in Germany a couple of years ago, frankly, from a medical practitioner perspective, we keep on dropping digital tools in their desks and without training, without support, without it being integrated into their workflows. And so frankly, what a lot of doctors did was they would keep on doing it the old way and do it the new way, which frankly led to resistance, led to burnout, led to frustration, and led to lack of trust of the systems themselves. So we have to address these systemic barriers. Next page, please. So what we really have to do for AI in health is find a way to balance multiple forces at the same time. We have the market forces that want to move fast. We have the health forces that want to do no harm. And I think one of the most important forces, the human forces, that make sure that the value is attributed or the value is accessible by everyone, by all, without financial hardship. And so by pulling these things together, it really leads us to the idea that what we want to do is scale to everyone while moving fast and doing no harm. And so literally the tagline that I've got for this is, how do we scale fast while doing no harm? And I think that's really important, but also reflecting that harm comes in many different forms. And I'll touch on that again in a couple of slides. Next page, please. So one of the things that the OECD did back in March, we published a paper around a checklist for the effective scaling of AI across health systems. And there are several things that we noted in doing this report. We scanned all 38 OECD countries. We found that there were 7 that had developed a specific strategy at the intersection of AI and health. And the reason why it's important to have a strategy at that intersection point, or having some form of governance or oversight at that intersection point, is because the resolution of those 3 forces of the market of health and of humans coming together needs some place where the tensions can be resolved, where they have the authority for deciding, in this case, we will find this path that achieves the best of all worlds, minimizing harm and optimizing outcomes. And without a specific strategy or approach at the intersection of AI and health, what ends up happening is that the AI forces, the market forces yells at the health system, the health practitioner saying, why aren't you moving faster? And the health system says, we don't want to move faster because this is a breakneck pace for us, and we are afraid of doing harm to the patients. And without having that governance and oversight at the intersection point, those arguments will just persist. And so this is something that we're absolutely seeing. Having said that, only 18% of OECD countries have established an oversight body for AI and health. That number is increasing over time. Canada last week published their AI strategy, which featured health significantly. Don't know if I would go all the way to say it was an AI and health strategy, but it was certainly a heavily health-featured strategy. We also know that we need to include AI in some of our foundational processes like health technology assessments. We need to be thinking about how do we improve procurement in order to actually ensure that the systems we procure meet the guidelines. This goes to the remarks around the CE marking earlier on. How do we make sure that the solutions are both interoperable with each other and integrated effectively or integratable effectively into our clinical pathways and workflows? And possibly most important, we have to be thinking about upskilling our workforces themselves. And I will point out that across the OECD, across these 5 core areas, less than a third of OECD countries had addressed them. So there is a lot of work. Nobody is well behind. Nobody is far ahead. But countries that are starting to think about how to actually change mindset, build the skill sets to implement these tool sets, those are the countries that are going to go further and faster. But it does start with mindset. Next page, please. If you go to that report back that I referenced back in March, you'll see a whole bunch of the other factors that these strategies have. But next thing, moving on to there. So we held this conference in Madrid 2 weeks ago. And the major theme from that conference is that across international organizations and think tanks and everyone, there is collective noise. And what governments need right now to effectively scale AI in health is signal. Next page. And so we worked together with the experts to develop this form of an action plan, starting with what is our overall vision? Where are we going? How do we earn trust? How do we enable what works? And how do we prevent harm? I'm in the process now of receiving the final outputs from the conference members and participants in order to determine what specific actions we're going to call out and who would actually could deliver those actions and when could those actions be delivered. Many of the actions, frankly, are very related to the Apply AI strategy that we just heard about. And so I'm looking forward to working with the European Commission to make sure that we're both supporting them in their work and also amplifying their work to other countries and finding what leading practices exist elsewhere that could be usable by the Commission itself. Because this is a collective effort. And importantly, one of the things that we'll call out is that at this conference, it wasn't European-based. We actually had representation from 6 different continents, everybody but penguins from Antarctica. And we really tried to drive how could we collaborate. And if you move to the next page, there were 5 main insights that I got out of the conference, which may be important for you, for your consideration. The second thing is that, the first thing is that we are focusing on health and AI. In many cases, we're focusing on it in doctors' offices, in the hospitals, etc. But practically speaking, 250 million people are using ChatGPT for health purposes this week. 1 out of 3 patients in the UK choose to use an AI system before consulting with their doctor. Those numbers are not going to go down over time. Health today starts with a patient in their home with their cell phone consulting an AI system. And we do not know whether or not those AI systems are trustworthy. We do not know if people understand how to use the systems well. We don't know if the insights that they're getting from their interaction with AI are actually helping their health experience or hindering their health experience. And when they're meeting with their providers for the first time, we don't know what that interaction is going to be like. And what we do know is that it may be problematic. Understanding how health is going to operate in this new 21st century is absolutely critical. And part of that is ensuring that trust is a central challenge. We can deal with all the technicalities that we want, but if we don't earn the trust of patients and of doctors, frankly, all the technology we want won't matter. We have to spend time fostering that trust, bringing people in, making sure things are participatory and we're actively listening and meeting the needs of doctors and of patients with the tools and technologies that we actually have. We also recognize that our failure to act is itself causing harm. We are at a point where AI is better in clinical practice than not using AI at all. It can provide meaningful insights. It can save lives. And so the longer that we wait to implement these systems, the more that we are causing potential harm to people. So that is one of the things, and that is what causes my personal urgency in this space. We also heard from earlier that we need to really focus on how to scale. Pilots, getting to the last mile from pilots to scale is frankly very hard, largely because we have weak data foundations, weak digital foundations. We haven't earned the trust. We haven't designed the systems to scale. We haven't designed the incentives to encourage scale, data use, and reuse. So we need to be rethinking our incentive structures to achieve scale and to simplify the ability to scale our solutions. And the last point is that we need to build on our foundations and we need to strengthen those foundations, in particular the data and digital foundations themselves. I don't think I've told you guys anything that you didn't already know, but I do think that these are the 5 core insights that I got from this conference we had with leading experts from around the world, some of whom are probably in the room with us. And so I really think that it's important that we understand the need for us to be changing our mindset to adopting a more collaborative approach around AI, because this is not something that any one entity can do alone. This is something we must do together. I'm excited by the work that TEF is leading. I'm excited by the Apply AI strategy, because I do see that fostering the type of collaboration that we need in the medium and long term in order to realize the massive potential that these systems have. Last slide. And which is really just for me to say thank you very much, and I hope everybody has a good lunch.
Thank you very much, and thank you once again to all our speakers. I'm just going to take just 3 more minutes of your time, then you could go grab something to eat. So as we conclude the program this morning, the morning session, the summit is not over, just the morning session. So I would just like to summarize what has this morning been about. And I think this morning we've heard that Europe possesses many of the building blocks that is already needed to support trustworthy AI in healthcare, ranging from the research excellence and innovation ecosystems to data infrastructure, testing facilities, and regulatory frameworks. But then at the same time, the discussions have highlighted that bringing AI into healthcare at scale requires more than technological innovation. It does require access to data, real-world validation environments, clear regulatory pathways, and stronger coordination across stakeholders and EU member states. And a recurring message throughout the morning has also been the need for us to connect to existing efforts and definitely reduce fragmentation, whether through testing and experimentation facilities, the regulatory sandboxes, health data mechanism, and it all boils down to success will depend on how effectively these initiatives work together. And we have also heard that the next phase is about responsible scaling. That means creating the right conditions for adoption through supportive policies, regulatory certainty, procurement frameworks, workforce skills, and continued investment in trusted AI ecosystem. Ultimately, the goal is not for AI for its own sake. It's not just about we all have to jump onto the hype of AI, but the goal is better healthcare outcomes, more resilient healthcare systems, and tangible benefit for patients and healthcare professionals that is built on trust. And I guess that brings us to the theme of the events of the summit today, which says transforming healthcare with trusted AI, robotics, and data. So once again, a very huge thanks to all our speakers and to you all for sitting for the past couple of hours to engage with us. And now I would like to invite you all for lunch. And before my work will be done for the morning session, because you would be seeing someone else for the afternoon session, I would like to invite you all for lunch. But before lunch, I would like to kindly request, we would like to take a group photo, and we would like everyone to please go downstairs, and where someone will direct you on how we're going to take the group photo. And there would also be an exhibition of TEF-Health services, and also you get to learn more about eBRAIN. So enjoy your lunch break, and see you at 15 o'clock.
So, good afternoon, everyone, and a warm welcome to the second part of our Berlin Summit, Transforming Healthcare with Trusted AI, Robotics, and Data. So my name is Yasmin Podefal, and I'm very pleased to guide you through the second part of the Berlin Summit. So I'm a project manager at Berlin Partner, where I build connections between companies and research organizations and other stakeholders that power innovation in the city of Berlin. And within TEF-Health, I'm involved in engaging companies and other stakeholders and giving them access to the testing and validation facilities. And it's my pleasure to moderate this session today with such an aspiring group of experts who are actively involved in shaping the future of healthcare. And unfortunately, our first speaker, Federica Zanca from the EIC, got sick and will not be able to contribute today. So thus, we start directly with our SME panel, and I'm very happy that we're having Jana Fehr from Charité as a moderator, and I'm please welcome also our panelists, which are Emmanuel Bidol, Parveen Kumar, Alpha Tom Kodamulil, Frank Repel, Santiago Brandi. And our panel discussion yes, please give them a warm applause. Thank you. And the panel discussion will be about, so the companies will tell their stories about their innovations and going to the market and how TEF-Health can support here. Test.
funktioniert das?
This works.
Thank you. Okay. Yeah, good afternoon and welcome everyone. Today we already heard a lot about the evolving ecosystem for building trustworthy healthcare AI in Europe. And now we want to move from frameworks and from infrastructure and hear from the companies themselves who are building innovations within this ecosystem. And today I'm very happy to bring together 5 panelists from companies within this ecosystem in Europe. And I would like to give the floor to them actually to introduce their companies and what they're building and how they're contributing. And I would like to start with Alpha. Alpha, could you introduce your company and tell us what challenge you are facing or addressing with your innovation?
Hi everyone, so good afternoon, and first of all, thanks Petra and the TEF-Health organizers for giving me the opportunity to present causality biomodels here in this round. So causality biomodels, we actually founded in 2018. We are based both in India and Germany, and we are a spin-off from Fraunhofer Sky. So over the years, we were building ontologies, knowledge graph, and doing the explainable AI solutions for various biomedical applications. So currently, of course, the times have changed and everyone is using the LLMs, ChatGPT for everything. But when it comes to the real biomedical applications, we really need a trusted scientific intelligence. So there are lot of limitations what an LLM can do, in case of building the knowledge graph or ontologies which are used for the biomedical applications. So the first one can be the LLMs work on a large context windows, and there can be a chance that it misses a lot of details that's super important in a biology context, So then, of course, if you are really doing everything in a large context windows or in a large scale, let's say you go to extract knowledge from the whole PubMed, or let's say the PMC, then you are going to burn a lot of tokens. Basically, you are going to spend a lot of money. And of course, at the end, there can be a lot of hallucinations. The output is not really reliable. So these are the general things if you have already really worked in detail with the LLMs in a biomedical field. So what we focus, we do, again, more in a human-in-the-loop neurosymbolic AI framework. So this is what we focus, where we use AI and LLMs for building the knowledge graph. However, we really invest time. We have a team in India, which are PhD or master level curators. So they really check each and every triple of the knowledge graph. And we built let's say, a very focused knowledge graph. And then we call it as more like a seed knowledge graph or a gold standard knowledge graph. And then we use this knowledge graph to really, let's say this is more kind of a RAG approach, where you retrieve or you use this basic seed knowledge graph as the basis to build or to expand your seed knowledge graph. In that case, you have a more trusted, high quality knowledge graph. So this is the main idea. And of course, what are our main services? It's of course, we can work with all different kinds of LLMs. We can make, with the scientific expert review, we can make it high, let's say, high quality knowledge graph and ontologies. And then main application, what we are doing is personalized medicine and causal mechanism discovery, where we combine different kinds of data. So the real world patient data, cohort patient data, omics data, etc., with the knowledge graph, which is really coming with the causal mechanisms of a certain topic, let's say any kind of diseases also, and which can really give, let's say, personalized disease mechanisms, personalized biomarkers, and therapeutic targets. So this is what we are doing. Okay, so
thank you very much.
Parvin, do you want to go next and tell us what you do at Interlife?
Sure. Thank you for this opportunity. Special thanks to Professor Petra Ritter. Thank you, Jenna. So I kind of wrote a little bit, so I'm just going to look at here. So we are Interlife, and we are building AI-powered decision intelligence for preclinical research and drug development. Our platform helps researchers select, validate, and optimize disease models based on their relevance to human biology, helping bridge the gap between preclinical findings and clinical outcomes. At the core of our approach is our AI-driven Human Similarity Index, which enables us to compare, benchmark, and improve disease models for human relevance. What makes working with TEF-Health ecosystem particularly valuable for us is that validation is not something we view as a final checkpoint. Instead, we see it as a key differentiator and competitive advantage. Trust in AI for life sciences depends on rigorous evidence, transparency, and reproducibility, and that's exactly what a validation pathway, as what I've put up there, kind of provides. As shown on the slide, our journey aligns closely with services already offered at TEF. We start with data feasibility and management planning, ensuring the right data foundations are in place. We then move through data and metadata organization, AI readiness assessment, model evaluation, and benchmarking before testing and validation in real-world settings or sandboxing, as mentioned. Importantly, fairness and equity are embedded throughout the entire process, both from our company, also from the point of view of trustworthy AI principles and the EU AI Act. So today we are quite happy to say that we're already working with almost 40 academic and industry partners across Europe in 6 consortia and in multiple disease areas, giving us a strong scientific basis for validation. By working with TEF nodes such as KI, Charité, and Kreis in Sweden, we aim to independently demonstrate the reliability and impact of our technology, helping researchers make better decisions and ultimately accelerating the development of more effective therapies.
Thank you very much. Santiago, do you want to go next and tell us about EBRAIN Systems?
Sure, thank you. Thanks, Jana. Thanks, Petra, Ritter, and TEF-Health for the invitation. And good afternoon, everyone. I am Santiago Brandi. I'm CEO at EBRAIN Systems, and I'm seeing a very weird set of characters on the screen. So, okay, that means I can go off script. So, I'm Santiago Brandi, I'm CEO at EBRAIN. We have built a data pipeline for assessment, prognosis, and intervention of stroke powered by AI. Basically, what this means is that we take intrinsic metrics from our own solutions to assess the current state of patients and map that into standard clinical scales such as Field-Meyer, Bartel, MoCA, and so on. Then to predict possible trajectories of recovery for these patients, and then to tailor customized, personalized training therapy plans to maximize those recovery curves. Importantly, we do this by using end consumer electronics, so whatever device patients already have at home. A smartphone, a tablet, a laptop, and even a TV. The key here is that nobody needs to buy any expensive equipment, so we remove the obstacles for adoption, and which is the actual obstacle for telerehabilitation at scale, so we can really cover the care continuum from the hospital to the clinic to the patient's home. Right? And in this way, we avoid treatment interruptions and we maximize the treatment intensity, the 2 main factors that play into patient outcomes. And oh, it got fixed, great. And you also asked about the main challenges. So I would say that any company in the health space has the challenge of clinical trials, because we know that even a single clinical trial is a challenge because you have your design, your protocol design, then you have your ethics committee approval, then you have actually carrying out the clinical trial, and then the follow-up, and so it's very time-consuming. If you're subcontracting a hospital, that's very expensive. But then if you really want to sell across Europe, it's not enough to get the certifications, as some of the speakers earlier this morning mentioned. That's just removing an obstacle, but having a CE mark under MDR does not drive sales. So reimbursement drives sales. And if you want to get reimbursed in different markets, you need to replicate those clinical trials in each of the different markets. So this is practically impossible for a startup. So that's where I think that TEF-Health can contribute a lot.
Thank you very much. Emmanuel, do you want to tell us about Arlekin AI.
Yes, sure. Thank you. And thank you, Professor Ritter, for the opportunity and the invitation, actually, of today. So I'm Emmanuel Bido, General Manager for Germany at Arlekin AI. We're a deep tech company, and we build what we call comprehension models, which stands for applying intelligence into data intelligence platforms, which stands for analyzing a large data set and extracting value and intelligence out of it. We manage that by combining our proprietary model, which is unsupervised AI, that we combine with agentic and LLM. And this allows us to reach a result where we have unbiased and auditable and transparent actually analysis. This is something where right now we are mainly focusing on non-medical applications. So I'm a bit on the side actually of my panelists actually, but we face the same challenges because we work with and we are deployed throughout Europe, working with public and private institutions. And of course, we work into an environment where this is sensitive in terms of data. So it's a high-stake environment. And so, of course, whenever we come to a conclusion to the analysis made by the machine, we need to be as accurate as possible. And we tend to. So the challenge actually for us is the same. How can we build trust? How can we build a product and a solution that will be trusted and used by high-stake stakeholders? And this, I would say, is linked to something that we had to push a little bit forward, which is two main elements, reproducibility, sorry, I will manage to say it, and verifiability. So anything that is explainable. The moment actually you provide a solution, you need to be able to actually verify what you're saying. And I think this is key in the environment of Arlekin, but this is key also elsewhere. And so this is something we do support. I think any initiative to support trust in any of the AI systems that are being developed right now, it's the key moment and it's the key time to actually discuss about this and to set it up. And to give you some overview, we are right now actively exchanging and collaborating throughout Europe on an academical level, but also we're partnering actually with ministries throughout Europe. And we've been settling down in Germany actually since now 6 months, and so actively deploying. Thank you.
Thank you very much. And last but not least, Frank, do you want to tell us what you contribute to the space?
Yeah, I will. Thank you for sharing the microphone. Thanks, Petra, for inviting me. I'm the odd man out. So Akris has actually not specifically something to do with healthcare. What we have to do with is compliance in general and trust in particular. Akris is an outgrowth of TÜV in Singapore, to be exact, the digital service center there, founded by two of the leaders in the digital service center at that time, focusing 10 years already on the veracity of AI and what makes AI quality and risk assurance. And you can see the name of the company is Akris, which stands for AI Quality and Risk Assurance. So we try to automate the nasty things, okay? Because when you look at the life cycle of AI, one of the key elements is, as I said, trust and reliability. So you want to know what is the risk, what is the impact of your solution, and how can you control it. So this would be also interesting for you guys, so just make a little bit of advertisement here. How does it work? So as I said, our CTO is working for 10 years on that, and he's also part of the bodies writing some of the standards and the norms out there. And all of these information have been put, and that's something for Alpha, all of these information have been put in a knowledge graph that we apply to AI solutions. So basically what you do is you come from a use case perspective, which, by the way, has not been mentioned enough today. It's always about the use case, okay? So you put the use case in the engine, then our, as it's written on the infograph, deterministic reasoning engine will apply the magic, and then we will basically, on first principles, tell you on the right side, you can see that then is what is the impact of it. So it's the stakeholders that will be impacted by it, and what is the potential impact of the AI solution you're building. Next step is, so basically that could be something that you say, okay, impact is negligible, we just work with it. Microsoft Copilot in the operational environment, okay, that's something usually you would not check for risks, okay? But then the next stage would be that you look, okay, what is the complete, and this is very important, the complete risk profile of my solution, okay? You would look at all the risks that are associated with this AI solution, and when you see, okay, there's a number of high risks, which in a clinical or in a healthcare environment most probably is, okay, you would then move to the third stage, which we call control plus, where you would get a complete set of requirements that you would need to apply to assure I call it the veracity of your AI solution, and then ultimately you have the possibility to assess the solution and control along the life cycle. So that is pretty much a value proposition that we promise. And since it's automated, since it's on a platform basis, you can see the numbers. I put them in there. So you see, it's a real sales kind of pitch. We promise an up to 14 times ROI compared to what consultants usually do in a 6-digit, maybe sometimes 7-digit figures. We do on a much kind of smaller footprint and much, much faster. I hope that should suffice at the moment.
Thank you very much. So I hear from you that are innovating and building products, you want customers to trust your products, and you're offering a solution for risk assessment to help increase the trust in this product. I want to move now to also the support that TEF-Health can actually offer. Can I have a slide on that, please? Is it coming up? Maybe it's coming up later. TEF-Health also offers a variety of services across the life cycle of AI. So one group of services comprise data access, another one offers support for the development of AI systems. Then there are support services for independent testing and validation, and also what you mentioned, Santiago, for clinical validation. And another category is the support for the go-to-market, for really getting ready for the regulatory approval process. Now I want to ask our panelists. Alpha, you mentioned your strategy that you're building to really make sure that you're producing. You want to produce also systems that are trustworthy, and you put in a lot of effort into data curation and knowledge graphs. And I want to ask you, what support would be interesting for you from TEF-Health?
Mm-hmm. So I think the TEF-Health, I have seen there, the data I can kind of, read from here, data enrichment, governance, etc., right? So this is clearly one service that, let's say, I would like to use. And by the way, just as I have one more hat, so other than being, the Chief Scientific Officer at Causality Biomodels, I'm also a group lead at Fraunhofer Sky of Applied Semantics. So basically in my research as well as in my startup, the main challenge that I am facing is the data access. So like I already mentioned, we can make the knowledge graph which can explain the causal mechanism, but we really need, let's say, the real data, the real patient data. Yeah, the omics data or some data are, of course, publicly available, but, the real patient data is highly, it's not at all open, it's not at all easily accessible because of the hurdles from, the legal hurdles, as you all know, like the GDPR and everything. And we researchers, whether it's like a private company or whether we are in a consortium or whatever the case, we are waiting so long to just get access to the data. Yeah, so without the data access, it's super difficult to move forward with our research. And I hope TEF-Health can really help us, with the data access, data governance, and so on. And of course, even if we are getting access to the data, then there is a problem with the data quality. Yeah, we are collecting data, let's say, from different sites across the Europe, and there is, of course, different sites or different hospitals are using different kinds of data structures, different variable namings, different kinds of units, and so on. And it's super important that we need to make it interoperable also. So the quality assurance, a lot of efforts into the data curation, data governance, verification of the data, interoperability, everything, So I hope, TEF-Health can really, help us doing that. Yeah. Thank you.
Thank you very much. And Parvin, you mentioned your need for independent testing for the preclinical models that you're building. How would you wish such a service that helps you in testing these models? What would be important for you?
Yeah, thanks for the question. So essentially, we are a company that's building trust around the biological systems, so the preclinical models that they use in the lab. And these models are very important because they're basically used to study basic human research and also drug development, so bringing in. So we are in the business of building trust as well as a company, and we do that with a multi-omics approach and an AI approach. And so we understand the need for independent testing because all things said and done, there is the need for independent validation. So we do that for the biological models, and we are very happy for the right persons to come and look under the hood as to how we curate the data, how do we build our repositories and so on. So now, Alpha mentioned there's lots of data. There is some data out there in the scientific repositories. We also have proprietary partnerships now in place, but there absolutely needs to be a harmonization work done here. We have to implement the FAIR principles, and we have to build a use case specific database, which is so much of the work we're doing right now. And we're very happy to have connected with TEF at this early stage, and to the right experts and the specialists whom, in Sweden you have like EBRAINS-Health, they are there, the bioinformaticians, and they could potentially work with us through TEF to come in and look at what we're doing under the hood and give us that third-party validation. And these are experts as well, so they bring in perhaps some feedback as well. So having said that, I think, and I've mentioned this previously when we spoke about doing this in a way that absolutely protects our IP, our background IP, and that's really the secret sauce that we would love from TEF, to have this validation done under the confidential arrangements in place. Mm-hmm. Yeah, that's my point. Yeah.
Okay. Thank you very much. And Emmanuel, you also mentioned that it's so important for you that the models that you're building are trustworthy, especially because you're using these deep tech technologies and unsupervised learning and so on. What support are you looking for?
Thanks for the question. I will give you an example that leads me actually to the benefits, I think. Right now, whenever we work in environment with forensic departments or counterterrorism, for example, like the analysis and the end results can have some consequences in terms of freedom, actually, for someone. not to mention what would it be actually, and what it is in the medical environment. So for sure, like, to be trusted and to have the right tools for that and to be able to justify it is key. So that's why we had to be pretty strong on two elements, actually, what I mentioned before, explainability and also a deterministic actually approach to that, which stands for, like, whenever you type the same question, you have the same result, and whenever actually you have your analysis, you can be audited actually with every result you give by linking it to your sources and being transparent and being explainable basically on everything. And so, of course, like, when I see TEF actually using, whenever there's the assessment actually, and using terms like robustness, explainability, or fairness actually associated to it rings a bell. And I think we're all, like, working in the same direction there for a reason. And I think TEF is really paving the way to set up standards that are necessary actually for tomorrow, for us to have a point of reference. And of course, like, the more people, the more companies, the more actors actually are going in that way tomorrow, then it compounds actually even more trust actually into the tool. So this is something we should really advocate. And behind that, I think there's the term trust should be the end goal. But really what we're asking right now is AI to be accountable. So it means it's not only like the results that we need, it's the whole chain associated to it.
Thank you very much. And I also want to hear from Santiago. So you mentioned the need for clinical validation, that it's very important for the rehabilitation products that you're building. And I want to ask you, how do you currently approach clinical validation? Your company is already around for some time, and what support would be useful for you?
So thanks for the question. So the way we approach clinical validation is we typically form consortiums to apply to different European or national projects. And then these hospitals are either project partners or subcontractors in our projects. And we actually have now clinical trials ongoing in 7 hospitals across 5 countries. And where we actually have already used and will continue to use TEF-Health services is in that these clinical trials will provide a lot of evidence, right? But that's only part of it, right? As many people probably know, if you want to certify a medical device as Class 2A and above, you will need a notified body to certify that the process, the quality process in your company are properly implemented, and you will have to prepare a lot of documentation. So we have already got services from TEF-Health who have helped us prepare that in advance to the degree that it's possible. So I think that they have already helped us save a lot of time that we would have used with those notified bodies to understand even what we need and how it has to be presented. And I think that we will continue to engage with TEF-Health, for example, in the selection of a notified body, because not all notified bodies are made equal, I would say, right? There are different prices, different quality of the services. So I think that we're gonna definitely rely on TEF-Health for the selection of the NB. And then, of course, when we're about to get the certification for our new models, we will definitely engage also for market access to potential customers, potential stakeholders, distributors, and policymakers. Yeah.
Okay, thank you so much. And Frank, so Aikiris, I think, is maybe interested in bringing this risk assessment service that you're offering to the TEF-Health ecosystem. And what could companies expect if they were to reach out for you to receive the service, and how do you actually do this? Like, what are factors that you consider when you evaluate the risks and also the readiness of an AI system for deployment?
Yeah, thanks. How would you go about that? So basically, I think the first thing, how we see ourselves is a bit like the safety layer of AI. So I liked very much what Emmanuel said, because I think we're tooting the same horn. The idea is that somebody comes with the use case and then explains basically, let's say, and this is very simple, kind of simplistic way, explains a use case to an LLM, which is funny, as we're using LLM to dissect the use case, to make it actually machine readable. So we can throw it at our knowledge graph. And then I think what is the differentiator and where we do it differently is, if you would do a risk profile today, most of the companies, it's either the CISO or it's the data protection officer. Some of these guys, they have a spreadsheet and probably look into cybersecurity. They look into some safety aspects of it. At best, they look into the ethics of their doing. We are looking at different things. So the knowledge graph that we are employing is actually looking at 6 dimensions overall. So we're looking at cybersecurity, the safety of the product. We're looking at the ethical kind of use of the system, but we're also looking at performance. So does the AI actually perform to specifications? And one of my absolute favorites is actually sustainability, because these days what you can do is, and we just had a discussion over lunch, a lot of people throw tokens around like there's no tomorrow, right? Every token about 2 trees, I would say, roughly. So you could kind of train your LLM, you could kind of work with the LLM in different fashions, and each way would have different impact on society, but also on environment. So we're checking against these factors. But a very simple approach is that you just explain your use case to an LLM that then kind of puts it on a platform, shows you basically what it has extracted in terms of data, and would then give you what I said in the intro, would give you the first is the impact assessment, okay? Which stakeholders are affected by it potentially, and what would be the hazards and the harms kind of they could suffer. And then ultimately you would move up the value chain. But as I said, in very kind of effective and fast way. And the one thing is, because I think Alpha would also agree to that, because it's a knowledge graph, okay? Within this kind of unique kind of space we're spanning is 100% result you're getting, okay? So that's why we claim you get all the risks shown, you get all the requirements you have to apply to, and then it's your own decision basically in which direction you go. And maybe the final, one of the 2 final words is, for some customers, this actually goes into certification. So you could even get a trust mark. Our closeness to suit allows us, obviously they can look in this direction. But also, obviously, what it does, it guides you along the way for CE, for let's say MDR approval and so on, because you get all the requirements shown that are necessary in this regards. Pretty much that's what we're doing.
Thank you. And I remember what Santiago said, that there is also need for with the support that needs for the support of documentation that then goes to the notified body. So is that something that you can also offer with the risk assessment once this has gone through, that it's sort of nicely and can be handed over?
That's actually a very good question. I forgot to mention it. Maybe also how we want to play with TEF-Health is, as we, let's say, we want to be part of the ecosystem. We want to offer the services to interested parties. What we can offer is, because of the nature of Control Plus, which is one of our products, okay, where you would have to then, you get all the requirements, comprehensive list, and then you would have to provide evidence, okay? So according to the requirement, you would say, I got this evidence. So we're not storing the data, okay? But we give you the possibility to say, okay, we got the data available and it's stored there, which makes a complete register. So if an auditor comes, okay, at any point in time, you're answerable. Okay? You can say, okay, I have done this step, I have the evidence, I have the documentation here, and you can find it there. So that gives you, let's say, the unique possibility to have all information in one place. And if you have more use cases, because we spoke about that one, you have them in the same place. So that's pretty much how we're working.
Thank you very much. And it sounds to me like it also helps with the accountability challenge that Emmanuel was talking about. That you I
see possibilities to work together there.
Thank you very much. So yeah, I think we heard a lot about different innovations and different challenges that companies are facing, and also about the support that TEF-Health can provide on this journey. And before we close, I would like to look ahead and ask everyone in this room to make a wish to Europe's innovation ecosystem. And I would like to ask you, what single change do you wish for to accelerate the journey from innovation to market adoption in healthcare AI? And yeah, first I would like to ask our panelists to tell us about their wish, and afterwards I will open it to the audience and raise your wishes, and also for other kind of Q&A to our panelists. Yeah, Emmanuel, do you want to start, and then we go?
Thanks. Yeah, sure. I would say sorry, but it's not in healthcare. What I would love is to apply this standardization everywhere. That would be my wish.
I think there's always a tension between the rate at which startups move and other bodies move. So perhaps a little bit with the pace, but also, I think while we are trying to de-risk our projects and our cases and our companies, and we attest to these standards, we would like to join the list of the good kids in class and hopefully get positioned, like earlier on the slides, that companies are taking the services of TEF. And apart from that, I would just like to say that building a company like this in the EU definitely it's a strong point, because I think we have the best global regulation of AI in the world right now. Yeah.
Thank you.
Yeah, so let's say from the company perspective, and or from the research perspective, if I want to give a wish, yeah, to the EU Commission, or the EU level, then it would be something like an EU-based data provider platform. Yeah, so as I already discussed, we have in the EU a lot of challenges in sharing the data. Yeah, so because of the GDPR or any kind of national level, legal frameworks and so on. But as we also know that we have in other countries, let's say in UK, we have the UK Biobank, or if you even go further deeper, like dementia also, then they have the dementia platform, DPUK. So in EU also we need something like that, really a place, a platform where all the hospitals, all the research institutes, everyone can really submit their data. The researchers, the research institutes or companies, whoever is interested can basically submit a project, and the ethical committee also, can really check it and, give access to the data, free data or, with a fee, it doesn't matter. Yeah, but I really need, the easy one way of, getting access to the data. So currently it's like, if I want to get access to, let's say, ATNI data, or at Neuromech, then I should know that, these are the, let's say, the data sets that can answer my questions. Yeah, so we need like a data catalog which can be accessible, publicly accessible. The people can really check which data could really answer my use case also. And then based on the selection of the data, you apply and then you get access. So my wish, EU-based, data access platform. Yeah, thank you.
Thank you.
So this morning, some of the speakers were talking about the importance of going from fragmented regulation frameworks such as GDPR, MDR, AI Act, and so on and so on and so on, into a single framework that is aligned and that helps startups and companies not to struggle with complexity so much. So I would like to take it a step further, and since it's a wish, I would wish for a unified framework for reimbursement. Because as said before, certification is an obstacle, it's a stamp you need, but it's not a driver of growth or sales. So I believe that a unified reimbursement system, as complex as it sounds, would be a catalyzer for massive economic growth and impact for patients, and really a de facto free trade actually approach. So that's my wish. Yeah.
Thank you.
Business wish, I like it. Can I have two?
You can have two.
Okay, because I like what Pavin said. I think I'm with you, because regulation, standards, norms is always seen as a hindrance. And yeah, the way traditionally you would apply it, and if you would go with like traditional means of software development, you would always kind of fail. We hope to basically change that, but I think the strength that the EU has is exactly this regulatory framework. I used the example of GDPR over lunch. Okay, initially everybody said, "Oh, what the hell? Okay, why do we have GDPR?" And nowadays you can see a lot of jurisdictions in the world actually emulating it and even copying it. So there seems to be something to it, and I think especially when it comes to the EU AI Act, the way it's being planned and it's being deployed, I think will be a major differentiator of the EU. So wish number one is basically that everybody has to believe that this is something good and not seen as a burden or as a hindrance. If that is actually understood, that in itself is a differentiator in the global kind of competition. And the second thing I mentioned is in our initial discussion is I like very much, let's say, since day one when Petra told me the first time what TEF-Health is about, and the way it's supposed to drive innovation. It should further kind of the cause of e-health in a sense. My only wish is that you guys are really successful with it and you grow and you prosper. So I would even put a tracky on it, okay? Live long and prosper on that one.
Thank you so much. And yeah, now I would like to open the floor to the audience. Is anybody here who would also raise a wish to Europe's healthcare AI ecosystem?
Well, wish for a wish. What you said basically is a true single digital market. That's it.
Thank you. Was there another hand? I think there was another hand somewhere here. Ah, yes.
Thank you very much. Thanks for the panel. I'm within the Austrian social insurance system, and I'm enabling and building up an agentic AI service. Within this service, it's about a prevention assistant. And as this is new, I saw and heard from you some interesting points. For example, to start with the risk management tool. As it's the first time we're doing that, I made sure that we have the on-prem AI hardware, the AI factory within our data space, so patients' data and AI is next to each other. And are there similar AI projects that could collaborate on this one, where we can learn from each other? Can we bring in our ideas, enrich your ideas there? That would be the question. So basically, we're doing it the first time. We're building up the agentic AI system ourselves, and that gives us a lot of skills and possibilities. But of course, we oversee also things in risk management, for example. Yeah. So if you heard other social security systems which build up agentic agents in this area, it could be interesting to work together with them, or to help you have a win-win situation.
Yeah, 100%. Because then, you know, in terms of risk assessment, in clinical trials, risk for patients is always a big deal, right? So a monitoring agent that could really assess risk and prevent, you know, adverse events from happening in clinical trials would be very, very important. Yeah. So definitely, yeah.
Thank you very much.
It's a little bit adjacent to my space, but I also would ask, what would you be deploying the agents for? And I would say perhaps low risk, low stakes decisions or low-risk activity like gathering intelligence, gathering information, could be something that brings it to the fingertips of clinicians, could be a good use case for those agents. Yeah, I think because we have this human in the loop philosophy in terms of like more high stakes work and decisions, yeah.
Okay, thank you. Are there any other questions or wishes? Yes.
Hi. My question's for you, Alpha. You told us that it was hard for you or your teams to align clinical data. Have you had any experience with the OMOP model? And if so, what do you think about it? Does it work?
So OMOP is basically a data model. Yeah, so, and this is not a data, right? It's a common data model. This is not the real patient data that I have mentioned, yeah? And of course, OMOP is a great initiative that, you know, it can really map and make many data sets interoperable for sure. But when it comes to, let's say, some specific topics like neurodegenerative diseases or psychiatric diseases, we often want to extend the OMOP, yeah? So in my group, or in my research, we usually extend OMOP data model, for example. And yeah, but like again, you know, like the wish I did, you know, it's not the data, but it's a data model. Data model, of course, it's freely available, but not the real patient data. So this is the difference.
Thank you. Hi, my name is Anusha, and I'm in corporate strategy with a consulting firm. And listening to everything that everyone has shared, and I understand that the mandate that Professor Petra and her team has is quite massive. And my wish is that all the member countries can actually be involved and give support to TEF-Health, which I think you know, they're trying to get a common platform and understanding across a very diverse landscape like Europe is quite challenging. So I wish TEF-Health and all the member countries a good and smooth journey. Yeah. Thank you.
Thank you so much. Yes.
Yeah, I have two wishes. One is resilience and the other one is speed. I think I feel sometimes we're a little bit overrun by the Americanos and the Chinese. And in this country, when you want to talk to someone, he's either on vacation or he's sick or it's Christmas. And so that's at least what we... how we talk about these things. So we need to speed up, I think, and that's my wish. And we need to be resilient and just get our things packed and start things. Yeah.
Thank you.
Yes, hi. Hello, I have one wish and one specific question to Parvin, then after. So the wish is that what Marcello told us this morning about having some sort of sharing of best practices after having access to data would be totally shared across Europe in a non-competitive manner for companies and for anyone who actually wants to develop. It's like, let then the market speak, but let everyone go on the starting lane. And my specific question to Parvin has to do with your system. When you say you're looking at preclinical models, does this include organoids and organ-on-chip, as this is a proxy that's acceptable these days?
Yeah, absolutely. So I think my pictures were not so good on the slide. So those 4 pictures were actually organ-on-chip, organoids, in vivo models, and in vitro systems for throughput. So I think what we're trying to do here is to benchmark each one of them against each other and to the ground truth of human biology. And we're using a deep tech approach for that. Yeah.
I think there was another hand somewhere. I don't see it anymore. Ah, okay, thanks.
Hi, Frank.
My question is for you. We are building an early healthcare startup where we want to assess the healthcare workforce candidates to move into Germany and work to assess the healthcare workforce gap. My question is like, when do the early startups should start thinking about the compliance and this AI regulation strategies, and do you also like kind of help the startup founders in those?
This is not working. Hello? No, that's working. Finally, it recovered. It's good. Oh, that's a mean question. Obviously, being a German, I have to say, you have to have this in your blood, in your DNA, right? When you start. You should actually think of it from day one, as I said, but it's kind of simple because you think from the use case, okay? And then let's say you could employ, obviously, our product in terms of understanding what it entails. Because one of the key questions is basically, where do you want to, let's say, where do you create your solution and where do you want to deploy it, right? Because then the jurisdiction and the norm and everything kicks in for that specific jurisdiction. So you would get then, let's say, when you say, I want to have something I want to do in clinical support in Germany, right? Then all the regulations for Germany and EU kick in automatically. You can do this from day one. And as I said, in the past, if you do it traditionally, it would take quite some time, right? What we offer is that we at least can show you very early on, okay? And okay, I'm also an MD for the company, so I can say, look, for early starters, we can just find a very simple deal that you just run your use case through it, okay? And see basically what comes out there. And then you can run with it. At least to get an indication, okay? What are my impacted stakeholders? What are the risks, okay? That's something that I wouldn't say we give out for free, but yeah, let's talk, okay? That's quite easy. But if you want to go then through the works, obviously there's more work entailed. And I saw one aspect that's in there. Our CTO is always involved when it comes to Control Plus, which means we always have a human in the loop also for our model. Okay, so there's nothing that gets out there and says, you have to do this. That's not validated, because that's, again, trust that we want to build in there. But yeah, if let's say you're interested, we can talk, no problem.
Sure, thank you so much.
Thank you. We have one more hand here in the back.
Thank you so much, Ira Haraldsen, Oslo. It can be maybe sometimes a little bit too German and too much control. We should not follow in the EU the German style always, I would carefully say. So there is a balance between regulation and innovation, and at the moment the ratio is extremely positive towards regulation. So and you need the capital and investment in scaling. And if you do not have the industry which is making profits by developments, you will not save the planet by academia. So how are you viewing your chances to become a company which really can scale, which maybe has also access to the right satellites for storage, transfer of data, and so on? So how do you see yourself in a global perspective and your chances to survive the next 10 years?
Well, I'll give it a shot. One of the advantages of perhaps being so, let's call it, obsessed with regulations and so on, is that then when you want to move outside, it's pretty easy. Because if you comply with the regulations in Europe, then you automatically comply basically everywhere else. So for example, we found distributors in Australia and Taiwan that were super happy. Look, we showed them, look, we have this certification, we have this, that's more than enough for us. Let's do this, guys. So I think that it's not a problem to jump abroad. I think it's more, for me, the challenge that I see in my company here is that the fragmentation in different countries. Each country is a market, and then you need a specific to go. For example, to take a local example, DIGA reimbursement framework. besides complying with the European regulations, you need, interoperability standards. The whole thing needs to be done in German language, the documentation and so on. And then it's not only Germany, it's everywhere it's like that. So I see more the problem here than moving abroad, personally. Yeah. Thank you.
Thank you. Does someone else from the panelists want to answer to this question?
Just to add, actually, something is lately, for example, in February, I was at the Munich Security Conference. And this is something that always strikes me is we forget to be proud of who we are in Europe and what we've built, and the market we have is the biggest and most qualified one in the world. And we should never forget that, and we should rush in that direction, actually, and maintain it, actually, and support it as much as possible.
I think we're quite lucky to have a fantastic deep tech infrastructure here in the life sciences, whether it's Karolinska or Charité. And then I think that we have to do really well on the evals for our use case. And I think this is the kind of foundation to sort of scale where you would like to. And there I would say, I'm not at that stage yet, but what I would do is to run an experiment with a smaller sort of segment to see what are the local specific challenges before we continue the journey. So that would be my answer. Thanks, it's a great question, yeah.
And I also want to add one, because I find the point quite interesting. Obviously, I said this regulatory framework is actually a competitive advantage, in my opinion. But you're right. But what I'm observing is also a lot of, and not the startups, that's a good bunch, okay? But I see this in corporate settings a lot, that actually people then employ AI, say, it's great, let's do something. They are aware of the risks, and they are aware of the regulatory frameworks and everything, but they're not aware of the risks. And all of a sudden, okay, even a spreadsheet shows them risks that they have not seen before. And I see it more as a psychological problem that people then say, oh, it's a risk. Hey, and that's insurmountable. I better don't do it. And we get stuck in pilot hell. And the value doesn't realize, okay? We talked about scaling. Scaling is not easy. It needs money. That's clear, right? But you see a lot of these people saying, oh yeah, I'm doing something, oh, that's very risky, I'm not doing it. So fragmentation, I totally buy that, okay? And the other one is really psychology. It's more that people get encouraged to take the risks. I think my observation after having lived abroad for quite some time, okay, is what we Europeans, particularly Germans, have lost is this kind of appetite for risk. It's a very, very strong risk averseness. If we overcome that, I think we are in a very good position.
Thank you very much. These were actually very inspiring. Do you still want to add to this? Yeah. Okay. Sorry, I didn't.
No. Just like I can, just agree with everyone here. We spoke about like the variety and all these things. So I also see like the variety, right? We have like these many European countries, and I think when it comes to the patients and everything, there also we see a lot of variety. Even if we say that we have only one or ethnic groups, still there is like a lot of heterogeneity, and this is something we can really make use. And yeah, Europe is clearly in a very good position. We are multilingual, yeah. So this is like we can really do much better than US or the Chinese. I would say this is what I can say. Yeah.
Thank you very much.
Yeah, exactly.
So I take it that you see the challenges with the strong regulation that we have, but you also see it as an advantage, and I also take it that you're looking quite positively into the future. And I think that's an amazing ending for our panel discussion. And I want to thank to all of you for contributing to this panel, and also to the audience who contributed. And yeah, I hope that our conversation has shown how Europe's ecosystem for building healthcare AI is really shaping. And yes, there is still lots to do, and let's continue building it. Thank you very much.
Is that something that
Yeah, thank you very much for this insightful panel discussion. I really learned a lot, and thank you, Jana, for the excellent moderation. So what I learned and what my key messages are, so we should not forget that we are in the European Union in a good starting position, and we should be also proud of what we are having. So regarding the market and also the regulatory framework, it's not only a challenge and a hurdle, but also an advantage. And yeah, it's all about trust, right? That's what we heard a lot. Not now, but also today in the morning session. And what is really important is having access to real patient data, but also having access to validation facilities. And that's so why we would like now to shift gears and bring in the perspective of testing and validation and certification providers that are also part of the TEF-Health consortium. And I'm very happy to have Tobias Schäftner here today from the Physikalisch-Technische Bundesanstalt, which is the National Meteorology Institute of Germany. And he brings extensive experience in MRI and data-driven biomedical technology. So please welcome Tobias Schäftner.
Yeah, thank you very much for the kind introduction. I have to say a few personal notes. First of all, I'd like to thank Petra. It's really great that you see to keep this endeavor together here and moving forward over the years. It's really fantastic to see how we have done already. Fantastic. Thank you very much. And then I'd like to talk a little bit about trustworthiness in AI, which is obvious, but more from a perspective of the test providing starting at the very beginning, from the data perspective, data quality. And I'll tell you a little bit about also about AI quality on it. I'm representing a team here, so they're listed here. As you said, I'm representing the Institute of Berlin of the PTB, National Meteorology Lab. But today, I have to say, I feel much more European than in the morning, I have to say. And so it's really, really great. And also, I learned from the previous panel discussion that we should think about our values. Yeah? So we, as a European, we have really, really strong values. And thinking about our values in this really strange times which we're having at the moment, then the AI Act is actually a good description of certain values. Yeah? It's maybe a lengthy document, but nevertheless, there are certain aspects therein which I think are very, very helpful to keep. And we just heard this is not maybe a burden, but is maybe something unique selling point. That we're getting something which gives you maybe a competitive advantage. And so this is maybe our aim here, that we have to, as a test provider, to showing if you're getting these kind of quality aspects, then you're having a competitive advantage. Let's work together on that one. So AI Act, as I said, lengthy document. I want to stress 2 paragraphs here, or maybe 3. One is on data, that we have to provide high quality training data, Article 10. And also then certification of the AI quality, it's Article 15. And we have heard a lot of times this already, robustness, accuracy, security, and maybe also paragraph 13, the explainability. And you will see this also on the booth, where we have seen really the life cycle there, and there are good people there explaining this much more in detail. Okay, this is on a very broad level. So, and we heard this today already, how can we get this into rules? How to get this really into practical rules? How we can, what we have to do with the companies? And this is something where we have worked in the TEF-Health project. I'm representing the work package 6 on standards and quality here, working together with very nice people, also from Fraunhofer, Heinrich Hertz Institute. And again, we working on the data quality and the model performance metrics. And the idea is, can we define metrics, how to define data quality, how we can define metrics, how to define performance of machine learning. And the overall idea is something like a European Nutri-Score. Yeah? Something like, can we give a stamp to say, okay, the quality, the data, what we're having here, obeys certain quality factors, attributes, and we have to give it a quality factor of B or better A. Yeah? Let's see. And the companies have to work together, and also the hospitals have to work together, that we're achieving these high quality standards. So let's focus a little bit on the data quality. And so what we have done over the years now, we had a stepwise approach. We first started at the bottom, really at the foundation, developed a framework for systematic data quality evaluation to check really what is really in the field. Then we tried now over the last 1.5 years to operationalize this in a way to define metrics, how to measure these things. And then finally, we like to go into some kind of tools with open source software, which we like to provide. Okay, let's go step by step. I put here also pictures of people on step. So this work has been led by Daniel Schwabe. He is in the audience. If you have more questions, talk to him. You will find him. And what we did at the early beginning is to look really at the detailed review, something like a Prisma approach, where we looked in 5,000 articles in the world and looking on data quality for medical AI. And we found a lot of aspects there, different terminologies, and I think the main achievement of this work was that we can brought this into a common framework. We defined 15 dimensions of quality attributes, and then which we can organize in 5 different clusters. And the clusters are measurement process, informativeness, timeliness, representativeness, consistency. A lot of people would agree on that one. And the nice thing with this makes the acronym metric, which we, of course, as a metrology institute like. And so the idea is, can we use these kind of organization to validate data, to see how it is, use it for auditing, and can we design reference, training, and test data? This is the main purpose. How, given a little bit of stamp, is it a silver, gold, or a platinum type of data set? All right. And then we thought about how can we operationalize this? Yeah? How can we make it, bring it into practice? And this is work by Katinka Becker. Also, she's in the audience. And more questions, please ask her. Yeah? And we call this the metric hub. And so the idea is that we, for each of the different dimensions and the clusters, we define what we call metric cards. Yeah? And this is something like a one-page information where we define how you should use these certain bits, what are pitfalls, and there's some kind of harmonized approach on these different approaches. And we heard about very much in the last session about that everything is use case specific. Yes, indeed. And what Katinka really is working on, has worked on, but is still working on, is some kind of decision trees, how to derive from a certain use case specific perspective, what kind of cards to select to get the best important or the most important metric cards together to find some kind of a data quality metrics for that one. So talk to her, talk about decision trees, talk about the metrics cards. We have brought this on a common web page. So actually, this is just submitted to as an article. It's on also preprint. Everything is available, and there's already a web page live. Very easy to assess. And there you can see all the metrics cards, 60 metrics cards for these 15 dimensions. And again, use case specific, you should think about what kind of cards, what kind of things you should use. All right, this is quite formal, looking to some companies' eyes already. And then the next step is this work by Martin Seifert. He's also in the audience, so talk to him. And he has done an open source Python package, has also published this one. And what he has done is to try to really make a tool, an open source tool, to look on the data quality aspects. Yeah? For one aspect here, we use a common data set, what we call PTBXL, from ECG data, is some kind of reference data set we are using. And if you uploading this data set, you will get some kind of a spider plot, or where you can see differences between two data sets, and we can see a discrepancy in the representativeness. We made this on purpose, I have to say, but we can see some class imbalance on these data sets, and we can see, yes, the representativeness in the red data set is less good than in the blue data set. Gives you some indication, gives you some ideas what kind of data metrics are good, which are less good on that one. So this is something which we like to provide as tools. We are working on that, and now is really the level to work really on specific use cases, on pilot projects in this direction. We also have worked on AI platforms. There are a number of test platforms already available. There we're working together also with the different TEF, the TEF AI matters, to share really knowledge in this area. So we're using a test infrastructure there, which uses reference data, automatic tests, and finally, we create a digital test report. This kind of stamp, what I'm saying, that we're giving some kind of a certificate in a certain area. Then I haven't any picture from Eva here, but she's in the back. They are from the Heinrich Hertz Institute working on platforms on AI performance tests. Very nice work on the booth. Also Simon is here, and again different areas like performance, uncertainty, explainability, fairness, and robustness, as we can see this one. Talk to them, they will give you a lot of hints. Segmentic lens I've seen, fantastic, talk to them. And I'll give you one example which we have used internally for what we call the digital PCR, so a way where we have to measure the size of certain droplets. Very easy task, to be honest, very cumbersome, but, and AI can help us, and we have to validate the AI and give a little bit of test on this measurement process of measuring the size of certain droplets. And finally, one example, what we see more from the Fraunhofer Institute also there, is work by Stefan Haufe on benchmarking explainable AI method for quality assurance, and again, some stuff which we're working also from with the local people here in Berlin, more on that one. So, in conclusion, trustworthy AI, it's easy to talk to this audience here. This is something like, in English we would say, bringing coal to Newcastle. Everybody agrees. But the challenge now is really how to make this quality assurance on data and models really applicable, make it really something which we can use on a daily basis. So for that one, we have proposed the metric framework with 15 dimensions and 5 clusters. We are working on the operationalization of this metric framework. We call this the metric hub. We have also did some tools. We call it the metric lib. Everything is open source. You can refer to that. But open source is one thing. Other thing is knowledge. Talk to the people. You have seen them. And then AI quality. The next thing is benchmarks. How should we do that together? How should we do reference data sets? How do defining of performance metrics? We need to go to the use case specific. I'm very glad that we're moving now to the step that we're talking to companies together and making indeed these kind of sandboxes lively now, that we're getting something like a co-development doing these things. And these pilot projects that should demonstrate the approach. I'm very looking to the future with all of you and working together the next years. Thank you.
Yeah, thank you very much, Tobias Schäffner. Very interesting. So it was very interesting to learn about the things you're doing at the PDB, and especially I found very interesting the metric lib tool, where you can test the data quality. So now let's move on to our next speaker, which is Danny Shakalaka from the SEED. So he's an expert in data ecosystems and digital innovation in healthcare. So please join me in giving a warm applause to Danny.
Great. Thank you for keeping with me this afternoon. I hope there's still some air left. And yeah, good afternoon. My name is Zdeněk. I'm head of operations of SEED. We are the medtech consultancy of the Charité, so this is pretty much our home base. I also have a colleague here, Matthias Fehlinger, so if you have questions to him later on, please contact him. We support AI companies, robotic companies, and medical device companies in getting access to the Charité ecosystem. And yeah, let me show you a little bit what we do, how we try to help innovators yeah, to tackle clinical realities. So we try to help them to understand clinical realities. In the last panel, the word use case came on, and this is pretty much where we start. We try to get them to really understand what the use case is, what the clinical and medical need is, and how that can translate into clinical practice later on. And we do that by trying to help them with the requirement engineering, with usability and workflow analysis. We also do regulatory and market access support. And last but not least, we try to help set up secondary data projects and try to give them access to real-world evidence. And we think all of these, you know, they follow you through your innovation process, and we think they are really important to think about from day one if you want to go on this journey. And if we look through several innovation projects, we see a lot of gaps that come up, and three are really important for us. We see often the problem is the clinical need really validated? And this is something we often see with the deep tech companies coming through to us. They are often technology driven, and they think they understand what the clinical problem is. And they have perhaps a clinical expert telling them, yes, this is a problem. But if you go on the journey, you should hear different voices. You also should hear the skeptics. And you really need to understand different settings and see if this really works out. Another problem, is this innovation? Is there any solution that this can be part of routine care? And this also means thinking about reimbursement pathways, and that also early on. Because if you have that in your requirement analysis, that can really change your product, and this should be really thought through. And last but not least, and I think this is something which echoes through the room, is there any way that the data you will need on your journey can be generated responsibly? Is there any way to get it in a timely fashion? Is there any way to get it if you want to scale up later on, that you're not stuck in pilot hell and try to set up a new pilot program everywhere? And this is something we try to help you with. I wanted to show you some examples where we did that. We did that with a robotic company from Munich. It's a startup. We tried to steer them in the way that we have a new kind of requirement engineering process before they actually go in the product validation. And we already thought about workflow integration. We already thought about reimbursement pathways. And later on, we went into usability testing and first prototypes and all the other stuff. Another project I want to tell you about is our project with Philips. We helped them to get real-world evidence for their PMCF studies. And I think the most important part here was not access through the or integrating the data itself. It was governance of the whole project, trying to get the secondary data, trying to maneuver them through the complicated ecosystem of the Charité. And I think this is also helpful as a blueprint for other projects where we can help you get the secondary data. And what we try to set up the project is that we give you a blueprint you can take to other clinics so that you can implement those kind of projects there. And you find a way how to get the secondary data in a timely fashion. And yeah, so I think we heard a lot about the technology, the validation, the certification side, but we also think, please think about the clinical need, think about workflow integration and the adoption. And yeah, please contact us.
Yeah, thank you very much, Danny. Very interesting. So, next I'm pleased to introduce Johanna Vernier. Johanna is director of the Center for AI Innovation at Karolinska Institute, and she brings a strong background in clinical research and healthcare innovation. And she's also the TEF-Health node leader from Sweden, I think, right? Yeah. So please join me in giving a warm welcome to Johanna.
Thank you very much. I'm the coordinator of the TEF-Health node and deputy node lead as well. So I'm going to take maybe a little bit a different approach. I'm going to tell you what the Swedish node is doing and how we are thinking about service provision and a little bit about our national environment. I think you've heard from governmental representative as well, for Malin, Vestin earlier today on the very good ecosystem that we are working within at the moment. So I'm going to touch upon that as well. But firstly, a few words about the Swedish TEF-Health node. It's led by Karolinska Institutet, have a partner in Research Institute of Sweden, RISE, as also represented by EIA.Lab, National Infrastructure and Center for Imaging Research. And we are actually very lucky in the node because we work in all of the different parts of TEF-Health, which makes we could even say that we have a mini TEF-Health in Sweden, which makes us really lucky because we know all the parts going on, and it also helps us in our everyday work to know what the other partners in all the work packages are actually doing, and we can support them and they can actually support us, which is really, really important for us. We are, I also want to point out, we are quite a great team. We are over 25 people in the Swedish node with complementary expertise in everything from AI innovation to AI development, health data knowledge, and regulatory parts. So I think that's also something that is really a great strength of the team I'm working with. And then another really great thing is that we have really supported in the ecosystem in Sweden. So we have even received a national funding for an umbrella project called Digi4One Health, SE, where we are coordinated together with other digital program projects in the health area, so that we are not, to make sure that we find the synergies, especially then with EUKIME and HDS Health Data Sweden, EDI, as well as European Genomic Infrastructure, and also local or national programs and work in the health data area. So to ensure that we are finding the synergies, we do not overlap, invent things that also is being done somewhere else, but also that we coordinate ourselves. And this is especially because the big denominator between these projects is actually health data and the access to healthcare data for customers, for academic, and for in not only a national level, but also in Europe. So I think this is a very good initiative, and it's funded by the Innovation Agency of Swedish Innovation Agency. Then I want to mention also that between two of the projects in the other project, HDS and EDI, as well as EUKIME, we even go further in, and not only through the umbrella project, but we really go in deeper and trying to find where we can complement each other, especially with HDS on how can we, because they also provide services to small and medium-sized enterprises. How can we complement each other? How can we make sure that we don't provide the same services, but maybe also how can we make sure that something that our companies and they have, we can direct them to them. They are more towards the earlier stage enterprises than we are, so we can actually talk to each other and say, we have this company that we can't help now, but maybe you can help, and vice versa. So we are really trying, or we are learning from each other and also developing services together, because together we get a really good overview of what is needed. And with EUKIME, we are in really practical terms trying to find out how can we, through TEF-Health, support SMEs getting access to the data that EUCAIM has in cancer images. So this is on a practical level how we work with other digital program projects. And now I briefly mentioned an umbrella project, but also TEF-Health. Normally when you get funding from a UU, the most of the projects end up in academia, in a PI, in a research group. And that might not be the right place for TEF-Health project per se. It's not a research project, we are developing services. So what we've then done, we've kind of moved the project out from a research group, from a PI in Karolinska Institute into a center that can live beyond the project, that can actually take care of the services we are developing and offer them when the project ends, and also maybe broaden the spectrum on who we can offer it to. And our goal is then future is to also develop a core facility for this. But for just a few mentioned that we now have a Center for Innovation that I am the director for, and here we are taking care of what we are developing in TEF-Health as well as other projects and broadening the services towards academia and healthcare to make sure that we have a spectrum and a bigger ecosystem where we can actually provide and help bringing these stakeholders together. So then, yes, we have a national structure. But then what do we do then or we have a local structure, an ecosystem. But what do we do on a national level? I mentioned the umbrella project. That is still a project. We have funding for 4 years there. But how do we develop a national platform? And there are initiatives ongoing, and we are really exploring on how we can do this in Sweden. How can we continue on a national level to give services and give access to testing and environments and so forth. And then we've talked, I think many have mentioned ethics here, and that's of course then on European level of sustainability, which we have great support from our government to explore and go forward with. And that's of course a great focus of ours. So then now I'm taking you from a little bit of a bigger picture into the more practical things. How do we work with SMEs? So this is how we start how do we find our customers to see all the contacts, everything, and through current contacts, but also exploring, even through internet search, that how can we find our companies? And then we put them in, who are actually in Sweden, who could we work with, who has AI innovation or robotics in healthcare? And then we can start contacting them and actually finding them. So this is a active, proactive work, or we're not waiting them to contact us. And for this, we have then developed a standardized process for how to do this. So it's not up to one person in our team that can actually only do it, but we think as a team, and we can all do this. We have everything from finding the companies through different, is it a net search or events, networking, how we first have a startup meeting, because I think we have a lot of services. Petra presented that we have over 360 services in TEF-Health. It's quite a catalog for the SMEs to understand the matching up. And for us, it's also we need to know the real needs of them. They have many, many needs, but they are also sometimes a small company. They can't prioritize. They don't have resources to go into 5 projects with TEF. They might need to focus on one first, and how to do that. So we need to really talk with them personally to understand where their real needs is and how to help them prioritize. And then we have a follow-up meeting. We dive deeper into their needs and hopefully find a good match from the TEF-Health consortium on who to work with, and then help them apply in our online platform that has been developed for us as well. So we have one way in. And then, of course, also going into providing the service in the end. This is a snapshot, and I realize it's quite small, but it's not intended for you to really read all of them. But these are examples, because I often get the question that what is actually the company is developing at the moment. So we tried to see, and we have 5. This is a snapshot of the current situation in the Swedish node. So we have 5 companies in negotiation for contracts, and then in dialogue 5 companies. But if you see of the areas, it's oncology, cardiology, rheumatology, mental health. So it's quite a broad spectrum. And they also, some need data, some need clinical validation, they need a platform. It's very vast, the askings of them. So we also need to have quite a broad expertise to understand what they are needing. So it can be everything, as you see, from oncology to diabetes, cardiology. So we need to have those experts and need to find them so we can actually give the best service we can for the companies. And what if we then don't find a match, but they have a need that we haven't anticipated before? Because many of the services we have in the catalog has been there for a while, some are new, but the environment is changing, the needs of the companies are changing, with AI changing, for example. But we have now also lucky that we have a system, we have a demonstrator, well, a work package, but the area where we can demonstrate on how to give services. So here we can develop new services. So a company comes in and say, we need this, and we can say, okay, actually we can't offer it. We don't have it in the catalog at the moment. But we think that, yes, some of the consortium members, maybe someone else can actually offer this, but it's not just listed. We didn't know that it was needed. So then we can test it within this demonstrator together with the company, the new service. And this is then a few examples of providing a gap analysis for the SMEs to understand where the best matches our services, but also how they should think about the whole environment of regulatory pathway. Where should they focus now? If you're a small company with 3 people, you need to focus on it stepwise. You can't take on everything at the same time. And through this demonstrator, we also developed a validation data service on how to validate on a new set of data the algorithm that has been developed or trained on another set of data. So this is a service we have developed within this demonstrator environment. And we work also quite a lot with data harmonization and how to do that and show on how to do that in practice. So what are our learnings? We've learned that the SMEs, they do need us, but they also sometimes need us quite early on, because if some of the things, if you're testing and you're doing the regulatory early on, it's easier, maybe upstreams. Data for validation is needed. It's not very accessible at the moment, and support for this should be provided in a trustworthy way. It's also important to build the ecosystem, and I think for the Swedish node and the front office, that we actually go out and meet the companies are really important. We need to build the relationship with them, because they are evolving. They need different things today that they will need in a year or half a year, actually. Also, the testing in real or realistic environments is very much appreciated, and also the navigation in the regulatory landscape. I think we've talked of everybody see the need of the regulatory and that it's actually good, but I think we need more clarity on how to navigate it, especially now when it's also changing a bit. So in conclusion, I think sustainability for TEF-Health, for what we are developing, is needed both on a local, a national, and an international level. We have a very strong support from our government, which we're really lucky with this. And I think this is something that I hope we can get for all member states. It's important for us to learn and adapt. So we need to learn from the SMEs on what their needs are. And have national anchoring to reach out to the community, to the SMEs where you are working. It's also important. It's very difficult to do it from one point in EU, maybe. Thank you.
Yeah, thank you very much, Johanna. That was very interesting to learn what the Swedish partners do and how they work together, and also how they manage to access the SMEs and to interest them for the TEF-Health services. Thank you for that. So now we would like to continue with the certification provider, with the TÜV AI.Lab, and unfortunately Franziska Weindauer cannot make it today, but we have a replacement, which is Matthias Sander. So he's a senior certification manager at the TÜV AI.Lab. So please welcome Matthias. It's great to have you here. Thank you.
Okay, thank you very much. I would like to discuss a little bit the challenges we see in AI-based medical devices and why we think that we need to get away from this notion of a single point-in-time certification being sufficient to show that AI medical devices are safe. And I want to convince you that we should rather discuss continuous quality assurance. First, a few words about who are we, who is the TÜV AI.Lab, and what are we actually doing. So we are trying to operationalize regulatory requirements, especially from the EU AI Act. And we are developing assessment criteria and assessment methods, and we are developing future certification processes for the different TÜV companies. And our vision is that Europe becomes a hotspot for trustworthy AI. And we are actually a joint venture of these 5 TÜV companies. And what is very important is we ourselves, we are not a certification body. So we are just developing the tools for the TÜV companies. So what are AI challenges in medical devices? Well, I think we all agree that AI already increasingly influences clinical decisions. But there are still a lot of issues and challenges. And I think we heard this quite some time today, that data is an issue. So it's access to data, which is really hard, but it's also a lack of knowledge how you actually prove that your data has high quality. And this leads to things like you see here, so where they reported that dozens of AI disease prediction models were trained on dubious data. So the question is, how good will these models perform? But besides this, there's a very interesting opinion piece which says there is no such thing as a validated prediction model. So it's a strong argument, but in the end, what the authors argue is that a one-time pre-market validation is just not enough to prove that an AI model will perform well in the real world. So what they say is you actually need to think about continuous validation throughout the entire life cycle. And I don't have a lot of time today, so I want to make sure that you get my key takeaway. And this is AI-based medical devices are challenging for manufacturers, but also for the TIC industry, because safety and performance are not fixed properties which are demonstrated once before market access. They depend on things like governed data, real-world context. Different clinics might provide different outcomes, controlled change, and continuous post-market evidence. And why is this the case? Well, AI can be adaptive, or AI is adaptive. It can even be continuously learning, and you cannot have one validation for a continuously learning system. AI medical devices are data and model dependent. They can even be non-deterministic, so you completely need to rethink your testing strategy. And they can also be opaque, which means you don't understand why the AI made a certain decision. And how do we govern this in the EU? I think you all know we have a dual regulatory regime with the MDR, which basically remains the medical device backbone. It sets all the requirements for medical devices in general. And then we add the AI Act, and this adds AI-specific controls. And currently there are a lot of discussions if the AI Act is actually needed. And I think, yes, the AI Act adds a lot to the MDR. And one specific area is data governance. So we already talked about data being an issue. And the AI Act actually requires manufacturers to think about data management processes as part of their QMS, also data quality assurance. And apart from that, there are a lot of AI-specific risks which are just not addressed by the MDR. And these are generalization. I talked about only pre-market validation or good pre-market validation results do not necessarily guarantee that your model works in a real-world setting. You have things like data or model drift. You can have bias, susceptibility to noise, and a lot of just AI-specific risks. Then you have things like logging requirements. So as a manufacturer, you need to think about specific events that you need to log. So for example, if you have a misdiagnosis or things like this. And this logging must ensure full auditability and support root cause analysis in case something goes wrong. And you just don't have this type of logging in the MDR. And then, as I said, post-market monitoring becomes much more important for AI-based medical devices. And here, the post-market monitoring from the AI Act adds a lot of further requirements. So it goes more into the direction of a continuous validation. So the MDR already addresses a lot of safety and performance aspects, but the AI Act introduces additional important requirements. And there's actually a very interesting publication by the German Bundesnetzagentur, which compares MDR and AI Act and performs a gap analysis. So in order to really achieve this continuous validation, there's one really, really important thing. And this is the traceability of evidence throughout the entire device lifecycle. And this is what many manufacturers don't get right. So, for example, your data quality metrics should not come out of nowhere. So what you should start with is a solid AI system description. So what is your device intended to do? State your intended purpose. State your users, your target population, your clinical claims. And from this, you infer your quality metrics. This is data quality metrics, but also model quality metrics. And then you also need an AI-specific risk management. So you need to integrate all these AI-specific risks, drift, bias, you know the story, into your risk management. And then, of course, when you have the metrics, you need something to test against. So you need acceptance criteria. And this is important. They don't come out of nowhere. They should come out of your risk management, and they should come out of your state-of-the-art analysis. I heard a lot of times today, physicians make mistakes. That's true. AI makes mistakes. Right. But you need to argue why your device is actually good and can be brought to the market. And this is where the state-of-the-art analysis comes into play. And then you go into your pre-market testing, and this is still a very important step. You need your data qualification, you need analytical validation, clinical validation, and also, and this is sometimes forgotten, cybersecurity. And this also feeds back into your risk management, and this is also a requirement from the AI Act, that you need to perform testing as part of your risk management to really find the best risk mitigation measures. And this is also not specifically mentioned in the MDR. But then this is not the end of the story. You also need your post-market testing, so real-world validation, your monitoring, bias detection, drift detection, and so on. And this again feeds back into the AI-specific risk management. And this traceability must be visible in your technical documentation. So when you write this documentation, you're not writing this for yourself. You're actually writing this for the auditor, and the auditor should be able to understand this entire compliance story. So it's not a single validation report. This will not convince an auditor, but this entire compliance story will. And a few words about post-market monitoring. As I said, it's about continuous validation. And here also the AI Act adds a lot to the MDR. So the MDR, classical post-market surveillance activities, are literature reviews, clinical studies, incident management, complaint handling, and corrective and preventive actions. But the AI Act talks more about operational parts of the model. So you need to check your input data, you need to check your output data. So you want to detect model deterioration, and you want to detect it before it actually causes any harm. And this is what the AI Act adds. And you also need to constantly validate your model performance against the ground truth. And this is not really easy, because as a manufacturer, you don't necessarily have access to ground truth. And I think I already talked about the logging requirements. Okay, so again, key takeaway, I already had this, but for TIC providers, now the central question actually becomes, can the manufacturer control and generate evidence for the AI system through the entire life cycle, not only pre-market, but also post-market, to really have this entire life cycle governance. Okay, thank you very much.
Thank you very much, Matthias, and all the other speakers. So it was great to have you here. And I would like to have, because we have some time left, I would like to welcome you on stage again so that we have a short Q&A. So Matthias, Johanna, Tobias, and Danny, thank you. So, and yes. So, thank you very much. So it was really great to have you here for your insightful presentations. Are there any questions to our experts? Yes.
Hi, so we are a preclinical decision support company, so not really patient-facing and stuff like that. So could you elaborate on some of the regulatory pathways, or what are the validation pathways that we would be engaging? Thanks.
Sorry, can you please repeat the question? I have a hard time understanding you.
Absolutely. So we don't provide any diagnosis support. We don't actually work for clinicians. We work as an R&D tool for scientists, preclinical side of things, drug development and so on. So I would love to hear your comments for best practices as a company like us. Yeah.
So you mean best practices in terms of making sure that your AI is safe and giving the right answers? Well, I think the AI Act gives you a lot of guidance on what is expected from AI. And I think it's not that you only have to follow these rules if you want to get certified, right? They are kind of best practice. And so in my opinion, the AI Act will be state of the art. If it's applicable or not, it defines state of the art. And the upcoming standards are, of course, also very important. So there will be a lot of harmonized standards for the AI Act, which will be much more detailed than the actual AI Act requirements. And I think these will also be guiding elements, also for R&D and also for clinical research, in my opinion.
Just to add on that one, I think it's essential, and we had this several times today, is that you have to think about right at the beginning, this is integrated in your development process. And I think you have also mentioned this in your panel on that side. Having said this from the regulatory perspective, the certification, approval, that's one thing, but it's also important that we think about the reimbursement scheme already. This is something, and this is not about regulatory, but it's about really the clinical evidence, and it's also good to think this together, because this could be something which is also influencing then your testing on the AI side, if you're having a different business model in mind, which you have not thought about this as part of your development process. So think this together: regulatory, reimbursement, and development.
Thanks to the speakers. I have a question for Matthias. So very interesting, and I think that you rightly said AI models are a living thing, right? They're not like a medical device. Okay, this is done. This is exactly how it's going to behave, forever. So, but then, in practical terms, what's the burden that this implies? Like, how often will we have to be assessing that our models are behaving as they should, and so on? And can it actually be, done, right?
Well, I think I have to give you the regulatory answer. It depends on your actual model. I think what is important for your company, but also for your audits, is that all this quality assurance is embedded in your quality management system. And what I'm not implying is that there is constant oversight by notified bodies. This will not be the case. And I think you, as a manufacturer, have to see in your risk management what the actual risks are. And then your quality assurance measure, your post-market monitoring strategy must fit to this risk profile and mitigate the risks that your specific solution has. I think this is the key.
Thank you. Are there any other questions?
Tobias, what are the next steps for your framework?
Yeah, so the framework is the lowest level, it's the foundation, and you can see we have the metric cards now, and now there are the tools. And the next step is really to deploy the tools, to thinking about how we can make this for practical use cases and can show this in pilot cases. And we have to readapt. We cannot do for all use cases, and that's why we made the base really as open source. Meaning that also from certain companies, they have to work with the open source code, can modify this, and again, the best way would be also to, as regulatory learning, put it back as part of the open source code then. But that's the idea, that we distributing that and extending that and seeing how good this works. And we call this regulatory learning. How does it have a value, and has it not only a value for faster approval, but also has it some like a competitive edge type of perspective. That would be great to show.
Okay. There's another question.
The question, does anybody of you have any experience with the so-called Annex 3 high-risk AI systems? That means non-medical devices, but AI systems that might be also used in healthcare.
To be completely honest, I don't have any experience with this type of devices. So my specialty is medical devices. So unfortunately, I cannot really comment on those systems.
Okay, so then thank you again for your time and insights, and thank you to the audience for all the questions. Is there another question? Sorry. No. Okay, so then thank you again. Please give a warm applause to all of our experts. And before handing over to Petra Ritter again, I just wanted to briefly draw your attention to this white paper that was published by eBRAINS. So you can find a booth of eBRAINS here directly in front of the doors. And they published a white paper. And please take a look, talk to the peoples, and grab one of those white papers. So, and now I would like to hand over to Petra, which will share some closing thoughts.
Thank you very much, Jasmin. And I think it was a very inspiring day. Thank you for that very much. It was beautiful and inspiring inside. It's also beautiful outside, as we can see now. And we will have more opportunity for doing some networking. We have a reception. You will find snacks and drinks on the 4th level. I hope you have time and stay here. I know some of you are actually moving to the BioCap, which also just started in town, where we also have a big TEF-Health booth. So we hope to see some of you in the next days also at the BioCap conference. But now it's also the time to say thank you to all the individuals who were not on stage, and I would like to do that. You have seen already Lola, Omolola Adanlawo. She is from my team, and she was on stage, but there were many other people from the group who were behind the curtains and who did a lot of hard work to make all this happen. I would like to say big thank you to Leon Martin, Michael Schörner, Konstantin Bühlau, Luca Brandt, Luise da Costa-Zemsch, Jihai An, Jungmin Chin, Jin Liu, Shovik Powell, and also to one person who is not here, Dionysius Pedicus. He is actually maintaining the booth now at the BioCap. So he's there. They live streamed this event, so they were watching us from there as well. And you have the opportunity actually to watch the entire event on YouTube afterwards. It was live streamed and it will be also available. Surprise in your face, Tobias. I think you signed, or didn't you send the signature? So if you want to revisit it and may have a second look at what has been discussed here, or want to point to this to your colleagues, please do so. I also would like to thank, of course, thank all the speakers, not only the speakers who did a great job, but also the moderators, the panel chairs who did a fantastic job, and of course everyone who was here today, all the partners of the 2 consortia who were actually organizing this, eBRAIN-Health and TEF-Health, but of course also all the guests, you all who were contributing and who made it a very successful and inspiring event. Thank you so much. I hope you have some time to stay to enjoy drinks and food together, and the exhibition also is ongoing. Thank you.